Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus, gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Vanogita moru purita nonda kantai mantunat nyagi toru ilugar para ionra para gloria abibai islasen para honra, para gloria, abiba islasen para todo y tempo y paz para ita dan gini langit na bendición contra peligro na fansafuham Deus protegis languam contra peligro na fansafuham Deus protegis languam.
Good morning, Guam.
Howdy, everybody. It's Good Friday.
It is 6/12, Good Friday, Holy Week. Containing COVID. We're cleared. We got cleared by Father Richard Kidd yesterday to do radio operations on a Good Friday morning. I think he put in all the necessary paperwork with the man upstairs. So we are containing COVID. It's the KUAM News takeover of Guam's favorite I-94. Good morning, Bree.
Good morning, Christopher.
You know, all this time we've been doing this show, how many weeks? I lost track. We're in day 26 or 7. I forget. I'm going to find out.
I can't remember.
But I don't think I've ever asked you how you're doing. So I want to start this morning by asking you, how are you doing, Bree?
I'm doing all right. That's all I'm going to say.
That's
how about you?
I'm okay. Hanging in there. That's such a loaded question nowadays,
exactly.
Right? It's, hey, how are you doing? Okay, you got like 5 hours?
The abbreviated version. I'm okay.
Yeah, how's your cell phone battery? Hey, it's 6:13. As always, there's just a lot of stuff going on this morning. Definitely. As we continue to bring you the latest on Guam's effort to contain COVID, reminding you that you have the power. You got the power this morning to kill the curve. And we'll be telling you that all morning. Remember, we don't need executive orders, all that stuff. You just got to stay home, practice your social distancing, and, all that good stuff. Wash your hands. And now the governor has also asked that households kind of keep to themselves. So, no inter-household interaction, she said, right?
That's so hard.
Yeah, that's a tough one. And so as these new guidances continue to come out in this rapidly evolving situation that we're in, we'll continue to keep you guys in the loop. So we don't want you guys to follow all the orders that the governor's putting out. And so let's start with some news. We're doing a deep dive. We start the show again every morning with a deep dive into the COVID news. Real quick, let me run through the ways you can catch the show. 93.9 FM, of course. We're also streaming KUAM.com and the KUAM News app. Good morning to our Facebook Live listeners. Thank you guys for watching. We're streaming on Docomo Channel 10. And then Monday, we're wearing our Easter clothes.
Yes, we are. I can't wait to see you in your pink.
I'm just like, I think we might have we're committed to this, and now I got to go and check what I got in the inventory.
I thought you said your mom sent you an outfit.
She did, yeah. It's very pastel-y.
Pastel. You're not wearing a bow tie, are you?
Nah, no bow ties.
Okay, good, because I'm not under that.
I get muffin neck. Okay, so let's do it with news from the KUAM news team. Sabrina Salas Matanani. Good morning, Sabrina.
Hafaday, good morning, everyone. According to the latest information from the Joint Information Center released at 10 p.m. Yesterday, Public Health tested 34 individuals for COVID-19. Again, that was on Thursday. 3 tested positive through Public Health and 31 tested negative. Public Health's overall count also includes an additional 2 cases of COVID-19 that have been clinically diagnosed. While these cases have tested negative, they have image findings consistent with COVID-19, display typical symptoms, have epidemiological links to previously confirmed cases, and are being treated as COVID-19 cases. The overall count also includes 11 positive cases that were tested by the Naval Health Research Center in San Diego and 1 confirmed positive case through Diagnostic Laboratory Services. To date, a total of 126 cases tested positive and 2 were clinically diagnosed with 33 recoveries and 4 deaths. All 91 remaining cases are in isolation. So the total number of confirmed cases of COVID-19 on Guam stands at 128. Public Health Director Linda DeNorsi released information on 7 cluster trace investigations that have been completed for March 14th through the 20th. Public Health also finished their group setting investigation involving several locations, and DeNorsi also provided information on 7 other investigations.
Information regarding our clusters, or what we call the groups settings that we have. From March 14 to March 20th, we are going to regarding our clusters, or what we call the groups settings that we have. From March 14 to March 20th, we are going to report the following clusters. We had a Hafa a day bingo where we had 2 to 3 positive COVID cases. And to date, there are no other cases affiliated with that establishment of where they had gathered. And their timeline for the 14 days is complete. So we're not worried about them at this point in time. The Sinyahanya Senior Center was another area where we had 3 positive COVID cases. Another area was a golf trip in the Philippines, and this individual also plays bingo. So there was a total of 4 positive cases. So that person that went golfing also had a golfing partner, and he also had 2 other household contacts. Thus, there are 4 infections in that particular group. There was also a couple that went to the Philippines, and it resulted in that couple affecting 2 other people, one being their son and the other their son's friend. There were also cases that are travel related. We have 1 positive case related to, in the early end, traveling from the Philippines. And we also had off-island social gathering in the Philippines where 4 became infected as a result. And that was 2 sisters, a cousin, and a brother that's clinically diagnosed. There was also a fundraising activity that was related to 3 positive cases, all in the same household. So within that time period, there were 22 positive cases with these 7 types of clusters. In addition to that, we have also 7 other clusters that we've identified. As I mentioned earlier, was the Iglesia Ni Cristo Church, where we identified 11 positive cases. And as you know, that church also comes, and they have a church facility at Jigo, Harmon, and also the Opera Agate. There was also a family gathering, a birthday party at one of the hotels, and that resulted in 5 patients being COVID positive due to that gathering. There were 2 settings from the healthcare workers particularly, and that resulted in 17 positive cases. And as you know already, we had travelers that came from the Philippines through the United Airlines that we had 3 cases from the quarantine facility and 1 United Airlines flight crew and also 2 United Airlines flights from Honolulu to Guam. And what we're asking everyone, if you are in any of the final 7 groups of settings, we ask you that you please call the department right away so that we can immediately determine if you are a close contact with an individual who has been diagnosed to be COVID positive. You can contact our numbers, which are as follows: 480-7859.
That they've completed contact tracing for the following clusters: Hafide Bingo, Sinohanya Senior Citizen Center, a golf tournament, 3 travel-related groups, and a fundraiser. However, Public Health is actively investigating additional clusters of COVID-19 cases. As of April 8th, positive cases have been linked to 7 group settings in Guam that are currently under public health investigation. They involve the Iglesia New Cristo Church, where there were 11 positive cases, a family gathering at a hotel where there were 5, healthcare settings, 2 locations, 17. She wasn't specific about that. Various United Airlines flights, passengers in Government of Guam quarantine facility, 3 positive cases, United Airlines flight crew 1, and United Airlines flight from Honolulu to Guam 2. The number you need to call, or the numbers you need to call, 480-7859, 6760, 6763, or 480-7883, or 687-6170. Thousands of people in the meantime, as you know, if you've been watching and listening to our show, have been waiting in line for food. Thousands more have either been laid off, furloughed, or have seen a reduction of their work hours as a result of COVID-19. And during her media briefing yesterday, the governor announced that checks could be in the hands of Guam's most vulnerable by this time next week.
Thanks to the work of Department of Revenue and Taxation Director Daphne Shimizu and GITA Deputy Director Dr. Ricky Hernandez, I can report that Guam has received IRS approval for the total estimated cost of $134.8 million of federal economic impact payments to be paid to the government of Guam. Because our government was among the first territories to submit our draft implementation plan, we believe that checks associated with this program can be cut within about 2 weeks of IRS approval. I know that for the most vulnerable in our society, even that may be too long. For this reason, and under my cash management authority as governor, I have directed the processing and release of over $11 million in local funds to be paid by this time next week. Tax filers with adjusted gross income of $10,000 or less in tax year 2018 will receive checks in the amount outlined by the federal economic impact payments. Checks again, which will be cut as early as next week. While this local advance will help more than 10,000 individuals and children, we are mirroring federal requirements so that this amount can be reimbursed with federal funds. To do otherwise could jeopardize our response to COVID-19, damage basic government services, and cause unintended consequences. My intent is to help our most vulnerable people as quickly as possible, knowing that federal funds will flow. Let me be absolutely clear. This isn't new money we have found that can be appropriated for other uses. I am able to make this available now because of prudent cash management with the expectation that such funds will be flowing back to Guam. There is no additional cash for new programs beyond this point. I know that some of you might ask, why didn't we do this sooner? The answer is simple. No one should have to deal with empty promises or faulty financial plans. I wanted to ensure that we could identify cash for this advance, that it would be federally reimbursable, and that it wouldn't jeopardize our response to COVID-19 or other basic government services. And most of all, I did not want to make a promise I couldn't keep. I also want to thank Speaker.
On Thursday, she announced that $11 million in local funds will be used to issue checks to tax filers with adjusted gross incomes of $10,000 or less in tax year 2018 as early as next week, and that is prior to the implementation of the federal program, the CARES Act, the stimulus program. Lawmakers, in the meantime, met in emergency session yesterday, their first formal gathering since the coronavirus crisis broke out. Senators, you may have seen it, wore protective masks and gloves, and their desks in the Congress Hall were spaced out in compliance with the governor's social distancing executive order. There are almost a dozen bills up for consideration, and the session was punctuated by many short recesses as senators had to deal with very limited support staff. Most of the day was spent on the first bill on file, which was a measure by Vice Speaker Talina Nelson to provide hazardous pay differential for frontline workers dealing with the current medical crisis. They also discussed Bill 336 by Senator Therese Terlahi, which would direct the expedited procurement of critical medical supplies to save lives on Guam during the COVID-19 pandemic through the amendment of local law. Here's
Madam
more.
Speaker. Madam Speaker, just for point of information, as the previous colleagues have asked, the question is that, has the governor already reached her transfer authority to transfer among the government of Guam? No, she hasn't. I just got off the phone with the Office of Finance and Budgeting. She's only transferred up to about 11 million. So she still has some authority to still transfer within the government of Guam. I'm in support of this bill with the intent of what it's for. Maybe with the author, maybe we can word it differently to basically tell the governor, you're authorized to transfer 4 more million within your authority to buy what you need to buy to protect our people. Because at this point, from the Director of Office of Finance Budget saying that if she reached her max amount, then if she needs the additional authority, then that's where we come in. And that's the information I wanted to provide to our colleagues. So she still has some authority to still move money. Okay, so I leave that to the author and to my colleagues. Thank you, Madam Speaker.
Thank you for the point of information. Anyone else on the main motion? Anyone else on the main motion? Senator Clint.
Thank you, Madam Speaker. So in light of that new information that was just revealed by the chairman of the Office of Finance and Budget, it seems apparent to me that the governor currently has this within her authority to purchase the items that we're looking to reauthorize again through this measure. So in light of that information, I'd like to make a motion to send the bill back to committee.
There's a motion to send Bill 3-35 back to committee. Is there an objection? There is an objection.
On the motion, Madam Speaker, I object very much to that motion. It just, I can't figure the mentality that would tell us that, first of all, if you've been following along with this pandemic, we needed ventilators since day one, Madam Speaker. We did not get ventilators. Only this week, the governor announced we're going to get 30 ventilators from FEMA. I'm so glad, because we have only about, I think, 20-some island-wide, and maybe only, I want to say 12, I can't remember the numbers now, maybe 13 at GMH, Madam Speaker, but we did not have ventilator capacity. And this week, we had Dr. Cabrera show the whole island what we are facing. And that if we curb this pandemic 50% more than we are trying to curb it today, we might still have 700 deaths. And before people die of COVID-19, Madam Speaker, they can't breathe, and we need to put them on ventilators. And that's why we are fighting for ventilators, Madam Speaker, because our government has moved quite slowly in getting these, Madam Speaker, to be honest. Same thing with the test kits, same thing with the PPEs. Why at this stage are we having nurses crying to us about PPEs? And I don't want to take away from the efforts of these people who are working so hard. But I do want to say, I do want to make a point, Madam Speaker, with this bill that money should not be the option.
Point of personal privilege,
should
Madam
be that
Speaker.
the government puts the money in that we need to get this equipment, Madam Speaker, today, not tomorrow.
I apologize.
Point of
Senator,
personal privilege, Madam Speaker.
Is that a point of personal privilege, Senator Clint?
Yes, to be clear, the point I'm making is that the governor already possesses this within her authority, so this bill does nothing. The issue is not a matter of cash. The governor has the cash. She has the transfer authority. The issue is a lack of ventilators worldwide. It's a worldwide shortage of ventilators. There's a worldwide shortage of personal protection equipment. You can just Google it. New York's asking for ventilators. Trump's telling New York they don't need ventilators because Trump doesn't have enough ventilators to pass around. Just watch the news.
Madam
it's
Speaker,
on the news
point
every
of
night.
personal privilege,
Thank you,
Madam
Speaker.
Speaker. If I don't know what this conversation
Senator
is going to
Therese?
turn into when people are going to tell me to watch the news, because I watch the news every single day.
Senator
and I
Therese,
watch
please.
what happens at the hospital every single day and worldwide, Madam Speaker.
Please.
So I think that's really a ridiculous conversation
Please,
to
with
have
all
right
due
now.
respect.
And if I
I will
may say, it's not that money is not.
Senator Therese,
not
if
the
I may
issue, Madam
please,
Speaker.
with all due respect, Senator Clint, she does have a floor. I was checking with the clerk on motions to refer back. That is not debatable. I was getting a clarification on that. There has been a motion to refer back. There has been an objection. I must call for the vote. All those who are in favor to place Bill 333 back to the
Point
to
of
refer
information.
back.
Point of information, Madam Speaker, it's Bill 336.
I'm sorry, 336-35. Thank you for the clarification. There has been an objection. All those in favor to refer this bill back, please signify by raising your hand. Motion fails. Anyone else on the main motion? Anyone else on the main motion? If not, Senator Terlahi, would you like to close?
I would, Madam Speaker, and I want to thank my colleagues for their consideration and for not sending the bill back to committee. Thank you very much. I just want to say, obviously, I've been following the government of Guam's finances, and I am perplexed as well. If they needed the money and they could transfer from their other transfer authority, I would guess that they would. And this is just another option for them, because they seem to be using the statute that I am talking about here. They are using this $100,000, if they're informing me correctly. They're using this authority, not their other transfer authority. And that's why, Madam Speaker, it seemed very relevant to me that we expand this Emergency Health Declaration Transfer Authority.
Legislative Health Chair.
Bill 336 was eventually moved to the voting file. There are two bills in the voting file. The other one is Bill 326 by Vice Speaker Talina Cruz. The items that are still pending discussion are the bills that the governor wanted to give her the authority to implement those social distancing measures that she was referring to earlier this week. As for Bill 340, this is the bill introduced by Senator Regine Bisco-Lee. It's the Recovery, Income Support, and Empowerment Act of 2020, or RISE. That bill was, I guess you could say, set aside as they wait for more information on the governor's proposal for that $11 million local payout. In the CNMI, we're still waiting for new information on the number of cases they have there, but the total count remains at 11 as of the information that was provided to us. Also out of the CNMI, though, all public school system employees that are locally funded will face a payless payday today. A memo went out yesterday to all PSS employees informing them that they are unable to make payroll today, but assured affected employees that once funding is available, they will cut checks. Now, these same employees are still waiting for 30% of what's still owed from their last paycheck. Federally funded PSS employees in the meantime will get paid in full. Earlier this week, CNMI Governor Ralph Torres said he needs to reduce the budget of the CNMI government in half because of the pandemic crisis. He is expected to announce massive furloughs in the coming days. One hospitalized and another in ICU. Vice Chairman of the Joint Chiefs of Staff, Air Force General John Hyten, spoke at a Pentagon briefing today about the status of the spread of the coronavirus on board the USS Theodore Roosevelt.
I think it's not a good idea to think that the Teddy Roosevelt is a one-of-a-kind issue. It's not a good idea to think that the Teddy Roosevelt is a one-of-a-kind issue. We have too many ships at sea. We have too many deployed capabilities. There's 5,000 sailors on a nuclear-powered aircraft carrier. To think that it will never happen again is not a good way to plan. What we have to do is we have to figure out how to plan for operations in these kind of COVID environments. And so when you look at the numbers off the Theodore Roosevelt, we've tested almost the whole crew now. We still have about 1,000 tests left to report out, but 3,170 of the crew tested negative. 416 have tested positive. 187 of those were symptomatic. 229 were asymptomatic. We still have 1,164 pending results, and we've now had one hospitalized and one in the ICU. So this is an interesting set of data. It's interesting for the country, but it's interesting for us. We have to figure out how this impacts our population, which tends to be a very young, healthy population.
Through the details of how they do that.
So, from a broad perspective, the sailors that are off the ship, there's 2,700 sailors that are off the ship now. If you think about 2,700 people going on to an economic structure the size of Guam, that's a pretty significant impact. So those sailors are all over the island. They're in houses, they're in hotel rooms, they're in different places, and there are teams of medical professionals that check on those sailors twice a day. And that's the procedure that the Navy put in place to make sure we walk through that. That's the procedure that was followed. And sadly, this morning we had our first hospitalization of the one sailor. I guess deep down I was hoping that we would never get to the point. I was hoping that the numbers would be zero at the end of this, but that's just not going to be the case with coronavirus. There's always going to be the one or two that come in, even in our demographic, and that happened for the first time this morning. So we're hoping that sailor recovers. We're praying for him and his family and his shipmates. But the Navy put together a good plan, especially given the
John Hyten speaking about the Theodore Roosevelt. So they've tested almost the whole crew. They still have about 1,000 tests left to report out, but 3,170 of the crew tested negative. 416 have tested positive. 187 of those were symptomatic. 229 were asymptomatic, and they still have 1,164 pending results. And now they have one sailor who is hospitalized and another sailor in the intensive care unit. In national news, millions of small businesses have applied for loans to keep workers employed, so much so that the government says the $350 billion already authorized will soon run out of money. But an attempt to unanimously pass an increase in the program's funding failed today. Skylar Henry is at the White House with those details and what the Trump administration is doing to keep the economy afloat.
Lawmakers are working to get another $250 billion loan program.
We do need additional money. We know that. But equally important, let's fix some of the kinks. And there are kinks in this program.
Democrats say they too want more funding to help small businesses keep workers on the payroll, but they also want billions more to buy medical equipment for hospitals running low on supplies.
There is zero chance that the sprawling proposal that our Democratic friends have gestured towards could pass either chamber by unanimous consent this week.
The Treasury Department and Federal Reserve announced an expanded $2.3 trillion lending program this morning to support businesses and workers, as well as state and local governments.
We will continue to use these powers forcefully, proactively, and aggressively until we're confident that we are solidly on the road to recovery.
The White House is working on plans to begin reopening the economy as soon as May 1st, when the current 30-day social distancing guidelines are set to expire.
We could do it in phases. We can go to some areas, which some areas are much less affected than others. But it would be nice to be able to open with a big bang and open up our country, or certainly most of our country, and I think we're going to do that soon.
More than 10% of America's workforce is now unemployed. Skylar Henry, CBS News, the White House.
The Mass at 2:30 p.m. on TV 11. It will also be streaming on our KUAM News Facebook page.
Okay, thank you so much, Sabrina. 6:40, containing COVID, the KUAM News takeover, Guam's favorite. We're going to take a real quick break and come back with Christina Schwen. She's we've interviewed her a couple times. Her son is a sailor on board the Roosevelt. So with these numbers, I haven't been I didn't follow the Roosevelt yesterday.
Yeah.
So the numbers you're putting out, I think, are very concerning because now we're dealing with how many of them are symptomatic? Like 100 something, and I mean
200. Actually.
Yeah, that's going to be that's going to have a
symptomatic.
Yeah.
187,
right.
and then 229 were asymptomatic. 416 positive, and one in ICU and one hospitalized.
Okay, so we're going to talk to Christina and find out where she's at. I'm sure it's not a good place, and it's Good Friday. 6:41, Guam's favorite. We're KUAM FM in Agotnia, Guam. Good morning.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hapade everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together. This war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat or Happy Birthday a couple of times. But make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers. And you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
Hapade Guam. My name is JJ Ambrose. That's Juliet. This is Isabella. And that's Applejack. For the last 2 weeks, pretty much since she was born, we've been stuck at home in quarantine. I miss my friends, I miss family, I miss going to the beach, and I definitely miss going to school athletics. But the silver lining is I get to spend more time with them. We've been catching up on homework, working out, and I've been changing a whole lot of diapers. But I know there's an end to this. We've been doing our part. We're asking you to do the same thing. Stay home.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Alpha Day Guam, this is Rocky Martinez, local MMA fighter. I'm doing all my training at home, so man, I encourage you guys, please stay home. Let's help the community out. Let's help the hospitals, the doctors, the nurses, everybody on the front line. If we all stay home, it helps them out. And the sooner we can do this, the sooner we'll get done. So I encourage you guys, please be a team player for the community. We can all do this. We can all help each other. And man, let's get through this. We're a strong community. So again, I encourage you guys, please, please, please.
And Donovan, the fishing song on this Fishy Good Friday at 6:46, Guam's favorite, containing COVID. Something we've been following, obviously, very, very closely. The situation with the Theodore Roosevelt. We wanted to bring Christina on. She is the mother of a sailor on board that ship. Her son, Jose, is... you haven't seen him since they got to Guam, right, Christina?
No, I haven't seen them.
I guess we just start. How are you? I know that's such a loaded question, but I just wanted to catch up with you and you tell us where you're at right now, dealing with all this.
Truth be told, I didn't even know the numbers until I popped on here. When you messaged me, I popped on real quick and I caught the tail end of what Bree was saying. So I really don't know the numbers. One is in ICU, I heard Bree say. Other than that, I'm fearful, but I know my son is okay.
Are you able to, is he messaging you, or what are the rules for the type of quarantine they're under, and are you able to tell us anything about that, where he's at? And
he's on the ship. He's still on the ship. He has been messaging me. He is fine. He is not feeling any symptoms or anything like that. He seems in very good spirits.
Bree has the numbers, just because it's kind of interesting that they don't include the numbers in our local reporting, but the national news, and there's also a couple websites where they're tracking these numbers, so we're able to get that info. So Bree, what do you have?
3,170 of the crew tested negative. 416 have tested positive. 187 of those were symptomatic. 229 were asymptomatic. And they have 1,164 pending results. And then, as I mentioned, one hospitalized and one in ICU. And 2,700 are off the ship. And that was
that's one. Sorry, Bree. That's one that's hospitalized and another sailor that has been put in ICU. So that's two different, right?
Right, and that's from a statement from the Vice Chairman of the Joint Chiefs of Staff, General John Hyten, and that was from a press conference that was held at the Pentagon today. So I just pulled that down. But there is a website where you can get daily numbers. But I checked it this morning, but it wasn't updated till I think April 8th, which were the 9th. What day?
It's 10th
the
today,
10th. So
yeah.
from 2 days ago, I'll have Chris send you the link where you can
Yes,
check the
please.
numbers.
Yeah. So, Christina, I mean, you're kind of being in the dark. Seeing these numbers, they're very, very alarming.
They are very alarming, especially with the way that, the initial contact, they're saying, oh, we just want to make sure that they're going to be okay. We're not worried about it. Now, their numbers, and granted, it's a small space that they're confined to. So, they're sitting on top of each other. They're literally laying on top of each other. There's 6 people to one little itty-bitty space in their birthing unit. But initially they said, oh, we're not too worried about it. Now there's one ICU, there's one hospitalized, there's how many? 416 positive?
187 symptomatic.
Yeah. And I think maybe...
So they kind of pulled the wool over our eyes. And the parents, these are still young sailors. A lot of them are still very young. Some of them just out of boot camp. Mm-hmm. My son is not just straight out of boot camp, but some of them are. So, the parents of these kids are sitting there saying, well, hello, you said it was everything was okay. This was just a precaution that we're going back to Guam so we can be on land, so we can be near real facilities. And so parents were sitting there saying, hey, okay, I'm not going to worry too much about it until I know more. And so I'm sitting here, and every day, like last night, it was about 7:30, and I hadn't heard from my son, and I got onto Messenger. I was like, hey, what's up? And then he came on like 20 minutes later, and he was like, I'm okay. I haven't felt anything. I'm in good spirit. We're good. And it's like, dude, you can't do that to me. You can't sit there and let me be in the dark right now. This is not the time to be in the dark right now.
And that was last night when you spoke with him. So you usually get a chance to speak with him every day? I mean, through Messenger.
It's basically, one of those touch and go, hey, are you okay? Yeah, I'm okay. Okay, I'm praying for you. I'm praying for your shipmate. I messaged another shipmate, and he's like, can you also pray for my wife, because she's worried just as much. And I'm like, your wife is in my prayers, dude.
Mm-hmm. I noticed on Facebook there is a spouses or a family Facebook page for people that are related to sailors that are on the USS Theodore Roosevelt. Are you on that group by any chance?
No, I'm not.
No, okay. So you've spoken with other. I remember when we spoke last time, you said that your son's friends, they're also part of your family, your extended family.
Yep.
Have you heard from any of them? How are they doing?
I heard from 3. Last night we just touched base. So they are good, from what I know. I don't know if any of them are positive. And even if I did know, I probably would not share that. Mm-hmm. But they seemed in good spirits as well.
Mm-hmm. It's kind of
the same messages that there. Pray for us. I'm praying for you guys. Thank you for your prayers. That kind of thing.
Right. Christina, I remember when we first spoke. When the situation was first in the media. I remember talking to you. You were very optimistic. You'd said your boy is fine, and this was at the beginning of all this, and this situation has changed so much in the last couple of weeks. So I just want to find out, where are you from when we first spoke to finding out this morning these numbers, which are very shocking?
I'm still very optimistic. My Lord is a good Lord. He's a loving God. And I pray to him every day. And I've always prayed to him. And I'm not saying, people that don't pray, you're going to get sick and you're going to die. No, that's not what I'm saying. Please don't ever think that I'm wishing ill on anyone. But if my son gets sick, I know that he is healthy enough to beat this. And that's where I stand. And I'm going to continue to stand on that because that's what my faith tells me. That when I pray, my God will take care of me and my children and my son. And that's the only way that I can think right now. Because if I sit here and I dwell on the negative, I'm gonna drive myself mad. And I can't do that. I can't do that for my son, and I can't do that for the rest of my children. So I have to stay optimistic. I have to. And until somebody sits there and tells me your son is sick, you need to come over here to the hospital, then I'm going to sit here and I'm going to continue to remain optimistic.
And this has got to be, made more difficult in that this is Easter Sunday weekend. And
Yep. And we had a big elaborate dinner plan for the kids that are here because remember, I did not know Jose was going to be here. Technically, he isn't here. In my mind, he's somewhere out there in the middle of the ocean. That's how I see this. Even though when I do drive towards Naval Station, come down the hill from Santa Rita and I see that ship that's there, I'm just like, my son is in there. My son is there. He's a stone's throw away from me and I can't touch him. I can't hold him. I can't sit here and tell him I love him in my arms on Easter Sunday. It's Good Friday and I'm sitting here saying, okay, there's no meat. We have to watch the mass. Like, who watches a mass? My grandmother used to do it because she couldn't go to mass physically. I should not have to be watching a mass on TV. You know what I mean? But that's where we're at right now. And it's hard because I want my family with me and I can't have them with me because of this. Sorry. I seem to always cry when you guys call me.
You're making me cry.
I already cried 3 times. This is not how I wanted to start this show.
Yeah. I was surprised too when I pulled it up because, that's one of my daily checks and I couldn't believe it. Like, this is just a lot of people.
My thing is, how come the national news is getting these numbers before we do, and they're on our soil?
Yes.
Yes, it's a U.S. soil. Okay. But how?
Yeah. The admiral should be.
SecNav sat there and said stuff about, oh, the governor's sticking her neck out for us and da 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 yada yada. I'm not going to get into that whole speech. But if they're so concerned about our government putting their necks out for the sailors, then why are they not sharing numbers with us? Why are they only sharing it with the United States news?
Well, we know that they're like we've been saying from the beginning. There's over 20 Guam sailors and their families that are they are in this news, and so we're trying our best to get the stuff to come down nationally, and we're going to continue to keep you guys posted. I think the admiral. Maybe he's going to be at the press conference today, but you're right. We tried to ask Linda DeNorsi about this a couple weeks ago about including these numbers from the Roosevelt in the local numbers. And we didn't really get a straight answer. She said that if they're tested at Naval Hospital, the Naval Hospital is obligated to report it to public health. And so we now know that these sailors have been being tested at Naval Hospital. So we're not sure where the disconnect is, but, obviously we're looking at this relationship that the governor has with the admiral. And just wondering why there's not more transparency coming out of it. Well, Christina, I wanted to ask.
No, hold on though, Chris.
Okay.
And I've been thinking about this.
Oh.
It is maybe they are being transparent to the governor. Maybe the governor is the one that's not being transparent with us. Just saying.
You got a point there because, we found out about these meetings that the governor's been having with the Admiral and with the Secretary of the Navy. We found out from the national news. So, you got a very, very good point.
Yeah. I'm not going to, speak ill of Governor Liu either. But everybody seems to be playing the numbers close to the chest. And I get that because, if they say the real numbers, maybe more people will panic.
Right, or maybe China's going to launch another rocket, or
Let's not hope for that day, Christopher.
No. Christina, I want to. I just want to ask you because at the beginning of this, when I did the first story with you, you had made a comment about some of the comments that were going around, and while there were comments that I believe were totally uncalled for, I also felt that there were some very valid concerns that were raised by a lot of people in the community who feared this exact situation. They said that this was a possibility, and now that we're looking at these numbers, and I just heard from Dr. Felix Cabrera, the Governor's Physicians Advisory Council, that he's briefing the military brass this morning, so he can't call into the radio show. So I'm thinking that it's definitely got something to do with the TR. So we know Naval Hospital's capabilities, and obviously the governor, she did stick her neck out. There was a lot of backlash on this, and her kind of train of thought was, we're here to help. We're going to do whatever we can. So I just want to ask you now that this is happening, this is developing, do you kind of understand a little more where some of these concerns were coming from?
I had the same concerns, Chris. Don't get me wrong. Please, do not get me wrong. I had the same concerns. The problem that I had was they forgot that they're still human beings. And to sit there and, wish the bad ill that they were wishing on these sailors, that's the problem that I had. And we shouldn't be doing that. Everybody's going to get sick. It doesn't matter if you're black, brown, polka dotted, purple. You have a chance of getting sick. And those guys on that ship, they're not any different from any of us here on this island. And that's where my opinion always stood.
Right.
And I agree with you 100%. Chris knows how I feel about it and how I felt from the beginning about how they are human beings. And for us to just sit here and not help them, it's just unacceptable to me.
And I get the fear. I've always understood the fear. I fear it too. I have a 17-year-old here that, being inside the house is torture. It's literally torture for him. And it's like, babe, you can't go out. I'm sorry. I'm not doing it because I want us to fight. I'm not doing it because I trying to punish you. You can't go outside. And the kids don't understand. That's the hardest part. The kids don't understand. But my friends are all out there playing. Yes, okay, fine. That's on their families. That's not going to be you. I'm trying my hardest here. But I digress. The sailors are humans too. Please pray for them. I know it's all hard on everybody, and I know everybody's scared and fearful and all of that. But this is where we're at right now.
This is where we're at. Yeah. Christina, I want to thank you for your call. I can't even imagine we're all dealing with this COVID-19, but to have that added,
we're praying for you and everybody.
We're definitely. I'm gonna light some candles. I'm gonna light some extra candles this weekend.
Thank you.
God bless you.
Take care.
God bless you too. And hey, you guys have a good Easter. Good Friday. Don't eat meat. Watch church. Watch mass. And today's a day of fasting. Today is a day of reflecting as well on what He did for us.
Thank you, Christina.
Thanks, Christina.
Okay, you have a good day.
God bless you.
Too. Stay safe.
God bless you too.
Okay.
Okay, bye.
Okay. Oh, there you go. Christina Schwen. She's the mother of Jose Luis Schwen. He's a sailor aboard the USS Roosevelt. Bree, we just got, can we run through those numbers again from the Theodore Roosevelt, and then we'll go to break?
Right, yeah. Vice Chairman of the Joint Chiefs of Staff, Air Force General John Hyten, he spoke at a Pentagon briefing that was held earlier this morning for Guam. And he gave the latest numbers for the USS Theodore Roosevelt. They've almost tested the entire crew. They still have about 1,000 tests left to report out, but 3,170 of the crew tested negative. 416 have tested positive. 187 of those were symptomatic. 229 were asymptomatic. They still have 1,164 pending results. They also now have one hospitalized and one in the intensive care unit. There are also 2,700 sailors that are now off the ship.
Okay, so those are the latest numbers. We're KUAM-FM Agotni Guam. We got more news, and then we're going to check in with Dr. Hoa Wen and find out a little bit about what happened at the Governor's Physicians Advisory Council meeting last night. Obviously, there's a lot of stuff to still unpack from the press conference yesterday. And if you want to know what's going on with containing COVID on Guam, you come to the right place. It's Containing COVID, KUAM News. Good morning on you.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Today, I'm Jonagan Charfris, Senior Producer for KUAM News, and I'm sure you are probably tired of hearing it, but I'm going to say it one more time. I urge you to please, please stay home, to protect your parents, grandparents, manamko, loved ones, neighbors, hell, the entire island. Stay put, stay home, make sure you wash your hands, practice social distancing. I know it's hard because we miss hanging out with family and friends, but the sooner we do our part, the quicker we'll get back to our regular routine. We will get through this. Thank you, stay safe, and stay home.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hapana everyone, and hello mga kababayan. Nestor Lecanto here from KUAM News. Just wanted to remind you all that we are in the midst of this battle together, this war against the coronavirus, COVID-19. And just wanted to remind you, one of the best things that we can do to fight this is to wash our hands. I saw something on TV, and you need to do this for at least 20 seconds. You can maybe sing Row, Row, Row Your Boat, or Happy Birthday a couple of times, but make sure you get everything. Get the top of your palm, your hands, the bottom, your thumbs, in between your fingers, and you can even use just regular soap and water. But just wanted to remind you that we're all in this together. We're going to get through this. And finally, stay home. That's very, very important. Nestor Lecanto for KUAM News.
Hey, we got something great coming up for you guys tonight. It's called Stay Home Live Local Fridays. This is a cool little show we put together with a bunch of local artists who, of course, are staying home like you should be because we got the power. We got the power to kill the curve. So stay home, only go out when absolutely necessary. Do things like, plan ahead when you're buying groceries, maybe get a couple extra things. But really, you should be staying home. The Guam Police Department is doing checkpoints, and they started those last night. And we got more info on that coming up. But first, he was on yesterday, and, basically meeting with the governor last night, Dr. Hoa Nguyen. Good morning, Doc.
Good morning, Chris. Good morning, Sabrina.
Good morning.
So we just wanted to recap. We know that you guys had met with the governor last night and her people. So what went down in that meeting?
Yeah, again, Chris, yesterday the Governor Advisory Committee met together, but the governor is not supposed to be there. So we just basically talk with each other. And last night, the biggest challenge that we basically talk a lot about is the chronic care management. A lot of the people in Guam, we talk right now about the COVID patient and what we do with it and all that kind of stuff. But this thing not going to go over like tomorrow, the next day, and next month. It's going to probably the rest of this year. And what we forget now is that before this thing come, we have a huge problem with our disease in Guam, and that's including diabetes, hypertension, and cholesterol. And that's what we forget. So we talked a lot about last night because, as you know, and everyone know that a lot of people are staying home. A lot of people are not going to work right now, and sooner or later, these things go on. Quite a few of us will not have a job. So, when you don't have a job, you might not have your health care insurance that you have right now. And what we talked in committee last night is what to do with those people that does not have health insurance like they used to on the visit to the clinic, who pay for the visit, who pay for the medication, how they obtain the medication. Because if we don't take care of this problem right now, we're going to have another wave we call non-COVID patient going to hit the hospital, having a heart attack, have a stroke. It's a big challenge. It's a big talk, and that's what we try to come up with an idea to try to guide the governor in her decision of how to cover for these people that eventually will lose their job in the next few months. It's hard because you can see your doctor, but the medication sometimes costs hundreds. And, people don't have $100 for the medication. And so that's what we see in our private clinic right now is that people, when they stay at home, that their blood pressure go up, their diabetes getting worse. So it's finding the funding source to try to help these people in the next few months, maybe well up to January, February next year.
So you guys discussed this amongst your group, and when do you plan on presenting this to the governor, your concerns?
We will present a little rough draft to the governor yesterday to Dr. Mike Cruz. We are going to, this Sunday, we're supposed to meet because it's a holiday this Sunday for a lot of people. But we're going to probably try to finalize this probably on Tuesday or next week. Just to give her a rough draft that she can work with. It's a challenge, you're talking about, the thousands of people that might not have health insurance at all. And we've also, talking about the cost for the medication, especially the medication, pharmacy have to somehow take the risks of either fund the money or whatever they need to do. Because they have to get paid for their supply.
Was there any discussions in your meeting about these alternate care facilities that are supposed to be standing up at some point in time, or discussions about FEMA's resources that they're deploying here or have deployed?
Yeah, when Dr. Lewis Cruz, he's a major in the U.S. Army. He's responsible for that, and he gave us an update on those things, and they're still moving forward on securing hotel to, get ready to be used as hospital in case we need it. The key here, we plan for the worst, right? And if it doesn't happen, then it's good for everybody. We love to be wrong. Everyone here, like I say, every citizen on this island is a soldier, and we all fight. That's why the message that Christian this morning: stay home, stay away from other people, use a mask around public, because all of us are fighting. And if all of us are fighting together, hopefully all this projection is wrong, and we don't need to use those hotels. But yes, they are looking at 2 hotels, and they are trying to come up with a plan to convert this hotel into a place where people can be used as hospital.
And when you say that they're trying to convert these 2 hotels, are we looking at those hotels to be used for just the civilian population, or will we see sailors from the USS Theodore Roosevelt also being able to be treated there? Because when you look at the numbers that were just released earlier today, there's 416 that have tested positive. And I'm just wondering, where would all these sailors go if things turn bad?
Yeah, this is strictly for civilians. The Navy, they take care of their own. And and they the good part about the Navy is that they own young, and typically young people have much mild case and symptom than the elderly. The one that we are currently in the hospital are the elderly with multiple comorbidity. These are active duty people that's young, so just like anything else, they're going to have some very mild symptoms, and they recover fine. So, if you play the odd, most likely they will not need a hospital, including ICU hospital, at all. So they still very, like I said, they're young and active.
Yeah, we just had news, though, this morning, Doc, that one sailor has been admitted to the ICU and another has been hospitalized.
Yeah, that's we know anything can happen, but like I said, we don't know much detail about it to see why they, the person I just read on the news about taking the hospital, but there's other reason they taking the hospital. I'm not quite sure if it's COVID related or not. Because we don't have the detail of the reason why.
Yeah, I think it is because this was the Joint Chiefs of Staff Air Force General John Hyten who announced when he was breaking down the numbers.
Yeah, but we don't really know that which hospital they go to. I don't think that they go to any civilian hospital because the Navy hospital is a huge hospital. That thing is making for a war-like scenario. They can convert that to 1,000 beds, so.
Did you say convert it? Because when I was reading up on their website, it's a 42-bed facility.
No, but that's for regular.
Okay.
If, in case of war, that hospital can convert into a lot of beds.
Yeah, I've been there. It's huge.
Yeah.
Yeah. So it's just right now. It's just there's no sense of doing that in case of peace, but in case of war, that hospital is gonna hum. Yeah.
Right.
Okay. What about the rapid test kits? Was there any discussion about that?
We come up with the guidelines pretty much on who's going to be receiving the test kit and who's going to implement it. So in general, the majority of test kits will go to both the hospital to test a frontliner, okay, and then 50% of that will go toward certain clinics in order to do the patient care on the outside. So, those kits really, remember, myself, Dr. Barrett talked yesterday, the screening kit, we screen for the COVID-19. Even when you're positive for it, most likely you have, but you have to be confirmed by doing PCR testing.
And just so people are clear, the PCR testing is the test kits that we currently have, and then the serology is the rapid test kits. And the serology is through like a blood sample. And
it's a blood sample. It's a finger prick, and you can find out about 10-15 minutes. The PCR take longer. The good news about it is that I know that GRMC also tried to stand up their machine, and also there's a high possibility that DOS might be able to do that locally, just because they are in support with the Navy Hospital.
And in the rapid test kits, you have to send them. You said public health would be able to run those tests.
No. The rapid test kit will be run by either the hospital, and I will leave the GRMC and GMH alone for them to implement their own program. But for civilian wise, for our local physician, they can go to a certain clinic, and when you see the patient, you can use the rapid strep test. The rapid kit, just to try to see if the patient are positive or negative. Like I say, if it's positive, you can run the PCR to confirm it. If it's negative, if the patient really looks sick, in front of you, and the test is negative, you're going to scratch your head and say, okay, we're going to need to get the PCR to confirm that this is a false negative.
But if you're fine and you get the rapid test kit, then the likelihood that you are negative.
Right. I mean, you have to have some symptoms, Sabrina. I mean, if you walk into my office and you actually have no symptom at all, and you say, I've been exposed to someone that have COVID positive yesterday, I will not run the test.
Okay.
Because, you're not going to have enough ground load or anything to turn positive, and I'm not going to waste the test kit on you. I just tell you, go home, isolate yourself at home for 14 days, and if you have any symptom, then come back, let us know, and at that time we might retest you.
Is these rapid test kits? You might have said it, but I just want to make sure I'm clear. Is this just for the priority groups, or is this for everyone that is experiencing symptoms?
No. We break it down priority group. Priority group. The highest one is the hospital and the frontliner.
Okay.
And the frontliner is symptomatic. And we have the next priority group is basically other people in the community that basically have mild symptoms and also have no other comorbidities. If you are like yourself, right? You are healthy and you don't have anything. You come in with fever and some coughing and diffuse body ache. In the past, we cannot test you because we are so short. But now you're a perfect candidate for me to do the rapid test just to see if you're positive or negative.
How many of these rapid test kits do you guys have?
Right now, 0 is on the way, but we have to make sure that they are FDA approved. So once they get here, all the test kits will be handled by custom to make sure that they are FDA approved. If they're not FDA approved, there's a lot of test kit out there that is fake and is defect. So they have to be kind of confiscated by custom and take over the public health in order to kind of verify that, number one, the FDA, number two, and they don't have no defect in those test kits.
How many are we anticipating, though, to receive?
We don't know. That's the thing. Is that a lot of local company, we heard that they order thousands of those test kits to come in to use for their employee, and
what company was this, Doc?
We don't know, Chris. We don't know, but that's what we expect.
I heard it was Cortec.
Yeah, so we're going to kind of confiscate all those test kits because, like I said, you can test for anything, but if you are involved with a virus like this that can be life-threatening for the community, you do not use that to clear people back to work because you put a lot of people in danger for doing that without proper supervision from the physician and without involving public health in this loop.
Doc, construction is still ongoing. We get a lot of comments about construction, in terms of the number of bodies that are out there on any given construction site. What are your thoughts on that?
Construction, some of them are very essential, especially the Navy and Air Force. They still have to get their building up. They have everything up because, the plan of expanding the military here in Guam is still very important. So that process most likely will not stop. But, those companies have their own physician that kind of take care and monitor the worker, make sure they don't have any symptoms. And they usually, the physician usually kind of lock them down in the barrack and not have them go nowhere. So kind of minimize the interface between them and other people around them just to try to keep them isolated so they won't get sick. But again, if anyone that gets sick, I'm pretty sure that the physician take care of them, will lock them down in an isolation in a barrack somewhere.
Well, it's a lot of pressure to put on a private company.
Yeah, it's a thing. It's a private company that that is not working on base. They really have to do the same thing. There's a huge difference between the private company that do construction outside the gate and inside the gate. Inside the gate, they have a lot of restriction and a lot of requirement they have to put on the employee in order to be safe to work on base. Now, off base is a different story. They don't follow that.
Okay. Anything else that you guys discussed last night that you can share with us?
That's the main thing. Just a thing about the chronic care management, Sabrina. Chris, that is something that I tell you we are all nervous about because this is, I say, we were hoping that it's going to last just a month or two, but it's not going to happen. It's going to last you next year. So the people that have diabetes, hypertension, and cholesterol, and all other risk factors, they really need to get together with their physician and try to iron a plan of care. Because like I say, we do not want to have a non-COVID wave of patients hit the hospital. Then the hospital is really in trouble. So try to stay healthy. Try to exercise as much as you can, and try to watch what you eat, so you don't get sick. Again, we come to a holiday again this Sunday. The key here, do not barbecue and mingle with a lot of people. You can make sure that you spend time with your elderly, but do not hug them, don't come close to them, because this is where we're going to take a little more wave of people getting sick because of this occasion. So stay home, wear the mask, don't congregate, don't party with your next door neighbor, anything like that, and kind of respect your elderly and say hi to them, but do not come there to hug them because you're going to get them in trouble.
All right.
All right, Doc. And so the governor has kind of, in her press conferences, talked about additional guidance in asking people to only commingle with individuals that are in the same household. How important is it for us to follow this advice?
100%. I'm 110%, Chris. You really have to follow this advice. Like I say, this virus will take advantage of every opportunity like this special occasion to move forward and spread. So we all have to do our part in this one to prevent another wave of hitting us. Okay, it's very important. She's absolutely correct. You have to do this. Okay,
Doc. So how are you changing up your Easter Sunday? I just want to know because, we're all doing it, but you as a guy on the Physicians Advisory Council, we know you're right on the front lines of COVID. How are you doing your Easter, Doc?
I'm going to isolate myself on my boat and go fishing, Chris, Sabrina.
There you go.
I need it. I'm going to get seasick, Chris. I haven't been on a boat now for 3 to 4 months.
Wow. Okay, if you want to isolate anything you catch over here, you let me know. We have the technology.
Okay, thank you, guys.
Wash your hands, Doc.
I will.
Okay.
Thank you.
Be safe.
There you go.
Have a good day. Bye-bye.
Bye.
There you go, 7:30. That's Dr. Hoa Nguyen. He's on the Governor's Physicians Advisory Council. So that's the conversation that they're going to take to the governor. How are we going to handle these chronic care patients who are struggling with, like you said, the typical chronic conditions? And that's, I want to just, on a side note, that's one of the reasons why guys like Dr. Cabrera are so worried about the COVID-19 situation on Guam, is because they say, when you look at New York and Italy, world-class hospitals, all the doctors know that, they got some great facilities. So for those country and New York to be hit so hard and to have their facilities, bend and break, and given that our population is way more vulnerable, so we have, way more people with the comorbidities per capita, and that's why the doctors are concerned, and that's why you got the power.
Yep.
To kill the curve.
And you need to stay home and exercise when you can, and wear a mask, wash your hands, and really just stay home.
Yeah, and of course, we all know it's tough as we're heading into, this has been how many weeks? We're going all the way to May 5th. So this is where you start to feel it. Like, we were on a roll, Bree. We were on a roll before COVID-19 hit. We were going to the gym. I felt like I was really on the way, man. I was I was ready to release the Man Meet Chris Barnett calendar. But when COVID hit, everybody's been so busy. Thank you, Custom Fitness, for putting the workouts out there. So you got, whether it's walk around in the yard, you do some push-ups or some jumping jacks or something, just any little thing you could do to kind of get that heart rate up every day. Okay, so we're gonna get FEMA on the line here. They've got a lot of information that's come down in the last day. So Frank Mansell is on the way here on containing COVID. It's Guam's favorite I-94. Good morning.
KUM Communications.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Buenas and half a day.
Mabuhay. What's up, Guam? I'm Norm. If you're watching this from home, then great. But if you're somewhere you don't have to absolutely be, please go home and stay there. I know it's difficult for us to change our routines and habits, and personally, I'd rather be with my family and friends dining in a restaurant or going to the movies. But the timing, it's just not right. We're asked to make a little sacrifice now, but in the long run, it'll help to ensure that you and your loved ones remain safe. We're dealing with an unprecedented health crisis, and we need everyone's cooperation. Let's fight the spread of the coronavirus by doing our part to stay home so that Guam can stay safe.
Be healthy. Be informed with ITD.
We're getting a lot of comments about Lieutenant Governor Josh Tenorio. So we got the confirmation yesterday from Adelup Press Secretary Crystal Paco San Augustine that the LT will be calling in at 8. So just really looking forward to catching up with Lieutenant Governor Josh Tenorio. So right now we'll go to the phones where you have from the Federal Emergency Management Agency. He's the Public Affairs Specialist, Frank Manzel. Good morning, Frank.
Good morning, off a day.
All right, let's just get right to it, Frank. Do you have any information about this strike team? Are we going to be seeing a strike team coming
Are we going to see
Guam?
a doctor, the nurses, or are we looking at some teams coming to Guam? And if they're coming to Guam to assist, is it going to be on the military side or the civilian side?
That would be an order that was generated by the Health and Human Services Department. They are the folks that are deploying that team. I don't have eyes on when they're arriving, and that's an order that was placed probably afternoon before last. So that's just
as an order placed
formulating
by
right now.
By who?
The request was made by HHS.
Would HHS have to receive a request from the local government for that?
I'm not clear about that. I would say that our part in this is that we would get a request, then we issue what it's called a mission assignment, an order for a team. and they're categorized. They're pre-categorized and then pre-staged.
Mm-hmm. So you don't know when they're arriving, do you? Well, who comprises the strike team, though?
Pardon me?
Who's all a part of the strike team?
I believe the strike team was that was assembled by, and I think the congressman had listed those people that are on the strike team.
Right.
So that's the strike team as I know it. I don't have that up on my computer right now.
Okay.
Mm-hmm.
But it's a team that is assembled and ready to go.
Right on. Can we talk about? I was talking with Major Thomas, Salvation Army. He told me he was part of a conference call with a bunch of different non-governmental organizations, and this was about mass feedings. Are we looking at implementing any type of mass feeding program here on Guam?
As I understand, there's something afoot regarding that. I haven't seen the details of it. I know that the Salvation Army has that program, and they're what we would determine it to be called a private nonprofit. Mm-hmm. So I understand that there is some discussion about that.
And where are we with the program? So I was able to sit down with you, I think it was last week, and you had mentioned that during this pandemic disaster, there are certain programs that the government of Guam can ask for amendments in terms of what's available. So can you just kind of run through what's available here and then let us know if the governor has requested any additional amendments or any other requests to FEMA?
I do not have that. The request, the way the order was written, the way the disaster declaration was written, was that the other programs that we could turn on are under review. So that is, we first of all got the major push out of the way, which was the declaration. Mm-hmm. So we went from what's called an emergency declaration, which was granted pretty much to all the states and territories. And then one by one, as the governors applied for assistance, we granted what were called major disaster declarations. As those major disaster declarations went out the door, they were basic, if you like, vanilla type declarations. Everything else that was asked for is being considered by FEMA based on the documentation provided, but that was not in the original order, and we have not seen a revision yet.
Mm-hmm.
Can we talk about these field hospitals and the different things that have landed in the CNMI and on Guam from FEMA?
Sure. We have landed on Guam over the weekend. We had a 50-bed FMS, stands for Federal Medical Station. That is a series of 50 beds and all the necessities that go with that. There would be some medications, there'd be everything to keep that bed supported medically. And that comes in basically 48 crates, and they're being stored right now, ready for deployment when needed and when we have the site located for that. There have to be certain conditions. Can't be outdoors because it's not necessarily sanitary necessarily, so we have to find the right location for it, and we're scoping that right now. And as soon as we find a place for it, we'll have that place ready to go and then just move the beds in when required. There is a second 50-bed unit on order, and I don't know the status of it, but it should arrive here within a day or two. Mm-hmm. So those are also stored on island. So that's the medical units. When we have a disaster, usually we have what's called a push, which means that if a disaster is declared, if we don't have goods stored near the disaster, and normally we do, we have a collection of depot points where we would deploy these assets to as needed. But along with the disaster declaration comes what's called a push, and we push blankets, cots, water, MREs, basic personal kits, toothbrushes, toothpaste, that sort of thing. That's called a push. And with that push, we received the first part of our push. That came from the Strategic National Stockpile. That arrived Sunday, and it's being stored. Part of that was deployed to the territory, so they have part of that Strategic National Stockpile, and we have the other, and we're expecting a second Strategic National Stockpile push. In the meantime, the territory can order what else it feels that it needs, and they work through either Health and Human Services or they work through FEMA to fill that order.
Hey Frank, can you maybe shed a little light, because when people hear FEMA, they there's an association and connotation that they attach to it because of the many natural disasters we've had here on Guam, and so I think when people hear FEMA, they think of disaster assistance, disaster food stamps, and I know there's federal programs that are on the way, but are we looking at any of that? Is that a possibility at all, or should we just close our mind to it? It's not going to happen.
I can't tell you anything about that, simply because I don't know. Okay. Usually in this particular case, because you're looking at 50 states all asking for individual assistance, how would you accommodate that is kind of what we're looking at. I think when we talked last week, I tried to tell you about the difference between public assistance and individual assistance. Right. And the normal individual assistance that you would normally see on Guam would be typically following a typhoon, where you have disaster, the uninsured damages caused by that typhoon reached a certain threshold, at which point FEMA would activate and turn on a lever that says, yes, individual assistance would be available. And that would become grant money and funds that would be available to those that were affected. And at that point, they would register with FEMA, and FEMA would take a lot of personal information. They'd say, are you insured? What's your income? Have you lost your vehicle? So it's about a 45 to 50-minute interview that FEMA conducts with those people that register for assistance under the individual assistance program. And then based on the needs and the damage done to your residence, that would dictate, right, and your insurance, that would dictate, the grant money. Yeah. And normally that grant money is, generally speaking, about $6,000 or $7,000.
Right. Frank, we're very, very familiar with the process in a disaster, but what caught my ear was that you said that 50 states are also trying to apply for some kind of individual assistance. So can you just clarify that for us? What types of assistance, individual-wise, are these states trying to get from FEMA?
It would just be the normal ask that they have, and they would have to prove loss, and I don't know that that's going to happen, because there's economic loss, and that's going to be covered by disaster assistance program or disaster unemployment. But as far as physical property loss, that's kind of, I think, where we're at, and that's kind of what individual states are asking for. And it really doesn't fit in the box of what we can provide to individuals, because there is no physical loss of property. Right. And that's what individual assistance is. That doesn't preclude them from asking for it.
So we can ask, in other words.
They can ask, and like I say, there would have to be some proven loss of property for that part of individual assistance to kick in.
Right. So I wonder if FEMA, moving forward, this is obviously something we've never dealt with before, but if there's going to be some kind of fine-tuning in the enabling statutes or whatever they got to do to maybe kind of open it up a little more, where, clearly this is a disaster. Nobody lost their home yet, but, in many ways, it's more damaging than a storm.
This is unprecedented. There's no question in anybody's mind that this is unlike anything anybody's ever faced. But as far as making changes, everything that we do is based on the Stafford Act, and the Stafford Act is what we go by, and it is written and approved and edited and modified by Congress. So that's the book that we go by, is the Stafford Act, and until Congress changes the Stafford Act, none of these programs can change.
Okay.
I do want to ask. I'm on the HHS.gov website, and it does list supplemental funding as of April 6th, and for Guam it shows a total of $1.4 million. Do you know what this money is going towards?
No, I'd have to get back to you on that. I'm so sorry, I don't have that.
Okay.
Supplemental funding on the HHS site.
Yeah.
What about the barge, Frank? Are we still going to do the hospital barge? Where are we on that, or is that something that you guys are involved with?
That's something that we're not involved with.
Mm-hmm.
So as I handed that back to the territory, I'm not aware of it, and I've talked to people here, external affairs wise, and it's in their court, and it's their resource. If they have a resource that they want to use and activate, territories and states are certainly welcome to add that to the mix. FEMA comes in, and if that resource is available and the community or the territory chooses to use it, that's great. The important thing is to look after the health and safety of individuals, and that's kind of a partnership. Usually it starts at the first line level with the first responders.
Right. So how's the line of communication? And you being here, are you in constant contact with representatives from the governor's office? Because he keeps saying that, we got to ask, we got to do this, we got to request stuff. So is there open line of communication, and are they requesting stuff?
We have an open line of communication. We have staff from FEMA that attend meetings with the governor's office daily. We also have our representatives who are part of our team also attend these meetings. I, of course, am more in touch with my counterparts, both at the territory level and at the governor's level.
Frank, how stretched thin is FEMA? I mean, this is something that we, like I said, when we hear FEMA, it's like, to the rescue. But, I mean, you guys are dealing with something that is nationwide. And, I mean, and talking to you in that interview we did last week, I mean, are we starting to see resources, or should we be worried that FEMA, I mean, even FEMA, is not going to be able to provide the things that we need?
Well, let's say FEMA is rather a small agency in government terms. It's about 5,000 people. The rest of FEMA's resources and people that we send out on disasters are reservists. And those are people that are equipped with a credit card, a computer, and a phone. And they're on call. So if they could be watching the Weather Channel, and 2 days later they'll get a call and say, we need you on a plane at such and such a location. Those are our reservist staff. We do have an additional 6 members coming out here Saturday, and actually 4 on Saturday and probably 2 on Sunday, to support the initial team here, which is 4 of us. So we do have staff coming out to support this. We do have a similar, actually it's a much larger team going up to Saipan, and they are going up this weekend as well.
Okay.
Real quickly, just wanted to follow up on the equipment that's arriving related to the hospital equipment. So you have 50 here, then you're expecting another additional 50 bed.
Yeah, they're called FMSs, and they come as a unit.
Okay. So is this part of the effort by the government to stand up 2 hotels to be used as alternate care facilities?
This is going to supplement that.
Right. So this is basically they're finding a big field and they set up this field medical station, right, Frank?
Well, the field wouldn't be appropriate because we would need something that was sterile to a certain degree. So it could be an indoor facility, or if it were an outdoor facility, it would certainly be climate controlled.
I see.
But it's capable of being set up pretty much anywhere. I think if you look on televisions, you see them at convention centers and things like that.
Right.
And that's basically what you're seeing at the convention centers are multiple FMSs. They're either 250-bed units or a multiple of 50-bed units.
So just for clarification, it's going to supplement what the government's doing. It's not a part of those hotels that they're looking at.
Well, it's a whole strategy that they're looking at. You've got to prepare for the future, and part of that is, having the resources at your fingertips, which we're assembling right now. Fortunately, Guam has been able to somewhat keep things on the low end as far as what they call the curve. But that doesn't mean that we shouldn't be prepared for an increase.
Right.
So essentially what we'll do is we'll work with the hospital and the folks in the medical team here at the operations center, and they will say, all right, we need to, here's what we're going to need in the next 3 weeks. And they try and model that. And they'll say, okay, what resources do we need? Where do we need them? Who's got the wherewithal to pull the strings to get us into that facility? Does it meet all of our requirements? Because we're certainly not going to put a 50-bed unit in a building with asbestos in it. So there's a number of hoops to go through to make sure that you're not doing any more harm than good.
Okay. Well, also I wanted to follow up on, you mentioned the congressman earlier when we were discussing the strike team. Were you a part of any discussions? I noticed that on his Facebook page that he said that he was on a conference call with FEMA. Were you in on that call, or was it FEMA?
I was not in on the call. The conference call took place between our regional administrator and some other individuals at FEMA, and there was basically a discussion of, we brief the congressman often and let them know what's happening. So generally, if it comes from the congressman's office, it's pretty accurate. And yes, we do have briefings with Congress staff.
Okay, and so you'd be able to provide us that information on the strike team later today?
Yeah, I will.
Okay. I appreciate that because we don't get anything from him. So thank you.
I'm sorry that you don't get anything from him.
Oh, well.
Oh, no need to apologize.
You may from time to time notice that there are differences in numbers. And certainly what is ordered is not necessarily what's delivered.
Right.
So somebody in like a congressman will say, we're getting this resource, this many. We're more logistical, and we're going to say, well, maybe that's what was ordered, but that's not what was shipped.
Right. Yeah.
So what I'd like to do with you is provide you numbers.
Yeah, so we just reach to you directly, cut all the clutter and just get the straight story from you, Frank.
Whichever you choose.
Yeah, that works for us.
Okay.
Okay.
All right. Well, thank you very much, and I will call back with that information on the teams and the supplemental funding.
Frank, I know when I interviewed you, you told me that this is the life you chose. You're always away from home, a disaster to disaster. And I know you're away from the wife and the family, right? Being here, obviously.
Well, there are sometimes when she says to me, don't you have a disaster to go to, Frank?
Wasn't there like a hurricane or something?
Yeah. Isn't there something that you should... Don't I hear FEMA calling you, Frank?
Oh, Lord. So just want to wish you a happy Easter, and thanks for coming out, and just keep in touch. We'll be in touch. We got your number.
You know it, and I'll be here, and happy Easter to you and your listeners.
Okay, wash your hands.
I will.
Thank you.
Thank you.
Oh, there you go.
Safe.
That's Frank Mansell from the Federal Emergency Management Agency. On this Good Friday, 7:58. So just kind of waiting for Lieutenant Governor Josh Tenorio to call in. We did get the commitment, and a lot of people want to hear from him. I mean, the comments have just been going crazy. We got that on the way. Nestor Lecanto is going to help us unpack a session. How about that visual, Bree?
Which visual of session?
The visual of the senators.
Oh.
Wearing the masks and the gloves, and that was...
And some of them were outside in the hall.
Right. They
How was
quarantined Senator Clint Rogel. It looked like he was in his own room.
I object.
So there was some, it was crazy. I know a lot of you guys were watching, and the pressure was on. And man, I you know, one thing I wish we could take away from this COVID is how everybody is just paying attention. I know it's because, you know, our lives are basically on hold in all of this. But I want you guys to keep paying attention after this COVID is said and done. You know, when we kill that curve, just pay attention, because it's, you know, it's all about being informed and stuff, but it's also pretty entertaining.
Yeah, you know, I was trying to watch Session, but, you know, a lot of the times they were on recess. So, you know, in between that and then trying to cover the press conference and everything else that happens during a news day, it was, you know, most of the times when I tuned in, they were on recess. So it was kind of hard to follow.
There was a lot of recesses.
Yeah, so last night when I got home, I was like, let me just check this out. And then when I saw what happened with Regine setting her bill aside, and then Therese Terlahi, Senator Therese Terlahi, interesting stuff.
Yeah, it was very good. We're gonna deep dive into that with Nestor Lecanto from the KUAM news team. We're KUAM FM in Agutni, Guam. It's containing COVID. Good morning.
Distancing.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Be healthy. Be informed with ITD.
Pang Beach Tower. Call us at 649-4581. Victoria Printing and Graphics. Let us help you with your company printing needs. Trusted on Guam for 30 years.
Hey, KFC on the mic again. Promise we'll be gone after this.
Yeah. So let me tell you about this girl, yeah, she's so fine. And every single day she's running through my mind. And I just wanna call her mine, because your smile makes my day.
Running in. Hey, shout out to all of our listeners from the Federated States of Micronesia.
No more
Ali, Rananim, Ali. What else?
Kasalele.
Mogatin.
Mogatin, yes.
Kasalele.
Koshrai. Sleeping Lady. That's all I got of Koshrai. Fruit Basket of Micronesia. I had a friend from Koshrai many years ago, Koshrai Joe. Good guy. Very smiley. 804. We're KUAM-FM and Agatni Guam. It's containing COVID. Of course, Sabrina Salas, Matt Zanani. Let me tell you guys what's on the way. We're going to go deep dive session with Nestor Lecanto. Adriana Cotero's going to get on the phone. She's doing some really good work covering this Department of Corrections thing, which we didn't really hear much about yesterday. And I'm pretty sure they just kind of needed a day to just assess where they're at. So we're going to be asking those questions. One of the questions that a lot of people have been asking is about the Lieutenant Governor, Josh Tenorio. And, we were concerned. We had said yesterday, at this point, we just want to know if he's okay. And
right.
I want to thank him for, reaching out and calling us. Good morning, Lieutenant Governor. Uh-oh.
Okay. Can you call back?
Yeah, just call back. I don't know what happened. And don't blame me, Bree. Everything was set there. It was on hold. It was all looking good and everything.
Mm-hmm.
Okay, so we'll just do that. We want to go over the numbers real quick. The latest from the Joint Information Center, COVID-19.
All right, the latest from the Joint Information Center. They're out. You got me there?
Yeah.
The release came out at 10 o'clock last night. Public Health tested 34 individuals for COVID on Thursday. 3 tested positive and 31 tested negative. Public Health's overall count includes additional 2 cases of COVID-19 that have been clinically diagnosed. While these cases have tested negative, they have image findings consistent with COVID-19 and display typical symptoms, have epidemiological links to previously confirmed cases, and are being treated as COVID-19 cases. The overall count also includes 11 positive cases that were tested by the Naval Health Research Center in San Diego and 1 confirmed positive case through DLS. A total of 126 cases tested positive and 2 were clinically diagnosed, with 33 recoveries and 4 deaths. So the total confirmed cases of COVID-19 on Guam is at 128. As for the CNMI, we are still waiting for the latest results from the CNMI, but at last count, it was 11 confirmed cases in the CNMI.
All right, so let's try this again. Lieutenant Governor Josh Tenorio, welcome to the show, LT.
Hey, good morning. This is my first time.
Good morning. Well, we'll go
First
easy
of
on
many,
you.
we hope.
Yeah, hope. Yeah.
Yeah, no, this is your new format. I think it's pretty cool.
Yeah, so
and you know what? First of all, just thank you for continuing to come to work and for the news team trying to get the word out. I really do think that if we continue on this track and do a little bit more, we'll be able to really beat this thing down.
Yeah,
Agreed.
that's our goal here. We don't want to just flatten the curve. We want to kill the curve.
That's right. That's right. And it would be a good place for us to do it in the world, since we pretty much have a closed border at this time with the quarantine measures we've taken, and because we have a relatively small population compared to other places. I think that I'm very optimistic that we'll be able to find a way.
So what are the things that you've been working on?
So, I'll give you maybe an insight on what's going on a daily basis for me and for our team. Every day at 8:30, the governor and I meet with our team, the chief medical advisor. We have our people with our finance and people focused on the economy, and then our legal team, just trying to recap about everything that's happened the day before. The governor usually gets on these early morning calls with the vice president and the president. She's been able, both of us been able to talk to senior military leadership, tracking the kind of assistance that can be brought in, and really just trying to manage this very actively and making decisions to try and protect more people. And so then at 10 o'clock, we go into a partial Zoom meeting, partial in-person meeting with very limited leadership in the public safety and public health front, the airport. We monitor everything that's been, all the people coming in, any issues that are outstanding, what resources departments need, and trying to plan for, the next few days. And that's kind of like, that occupies most of the earlier part of the day. I decided to stop coming to, we're trying to adopt social distancing and and really trying to manage what our risk is. And so in the afternoons, we'll split, we'll work from home, we'll be on the phone, and then the next day we'll do it. So we've been at this every day, and we will do this through the end of this crisis.
LT, so is that why people don't haven't been seeing you consistently at the press conferences? Because, and I was wondering about that. That was one of the questions I wanted to ask. Was what measures has the governor and the lieutenant governor and you guys' teams taken to kind of mitigate the risk that, I mean, it's a real risk, man. I mean, you guys are rubbing elbows with,
so limiting the, trying to push as many things into Zoom as possible, knowing that there are some people that we need to see, but using the 6-foot rule, everybody at this point wears masks, and we really try and reduce the risk that we have because, quite frankly, we're meeting with a lot of people that are first responders, even people in the medical team that the leaders of the hospital that are in areas where there is a high risk. And part of it is trying to get all the employees and all the visitors to practice the protective measures for yourself. So, making sure that, and that's why there's, in the last few weeks too, trying to really examine and understand what more we can do to help the medical professionals make sure they always have the equipment that they need, but also to make sure to remind everybody to rely on their training and practice all their infectious disease control training. So part of it is identifying resources. I was able to, I probably speak often to superintendent who, all the school nurses, as you know, have been called up to public health service and they're out there. We keep an eye on the staffing levels right now on a daily basis. We keep an eye on the number of people in the hospital, what their conditions are, and then also the number of resources we're putting into surveillance. So if there's already more than 120 cases, each one of those cases, the individuals have to be identified, obviously. They have to be interviewed, and then they have to be traced. And so we're able to send in additional people. There's AGs investigators, probation officers, social workers, retired nurses working phones to mitigate their risk, to try and really do an adequate mapping about what's happening and where clusters would be or could be. And I think the other thing that has been valuable about how we are operating is, and I have to say that it's been very critical for the National Guard to have been there. Dr. Mike Cruz as the Chief Medical Advisor, Major Louis Cruz, another doctor, Dr. Cabrera, understanding where we are, including what's coming into the island for medical supplies. And then the other thing I probably want to say is that being aggressive, trying to identify all routes that we can get available to try and expand the testing capacity that we have. So, we're limited with the CDC testing to just a little bit above 40 a day, and the governor has been successful in trying to identify and get transshipped additional methods of testing. Because that's part of it, if you're reading what's going on, is you need to try and get as many people tested. And quite frankly, when we plan to reopen the economy, having a mass community testing is probably what is needed for us to get back on track.
What are we going to do, LT, when we do that? And this is something that the doctors have said, when we do that mass community testing and then we're sitting there with like 500 positives, is that going to, how do we deal with that?
I think what we might find, and this is just based on reading the articles and even watching some of the national news, there are probably a lot of people that were asymptomatic that never had symptoms that have those antibodies. And I think in the near future, when we do massive testing, I think we're going to find that many more people have been exposed, just like what they're finding in the States and in Europe and in China.
Yeah.
Mm-hmm. Can you tell us about Dr. Felix Cabrera? He's briefing the military, I believe, today. We just
this morning.
This morning.
Yeah.
Do you know any information about that? And
so on a daily basis, the U.S. Army Corps of Engineers, FEMA, Center for Disease Control, there are all different models that are going around, and Dr. Cabrera has done an excellent job trying to apply those models. and being very forward thinking on the models in terms of projecting what the need is. And part of it is really planning logistics and identifying the number of healthcare assets we need to bring in and to step up. So, we know how many additional beds that we're able to step up in the hospital setting. We know we've been looking at all sorts of scenarios to even doing some mobile hospital units, coordinating with the private healthcare providers, the clinics, the Surgery Center is another one, and trying to have a very unified approach to how we address healthcare. And so this probably not the first time he has a briefing today, but I would just tell you that there's been daily communication and pretty good open communication with the military partnership.
Right. I think what we were kind of wondering about is with these developments with the Theodore Roosevelt, where they're now looking at 187 sailors who are symptomatic, and over 400 have tested positive. Is the military capable, and do they have the capacity to handle that many positives, that many symptomatic sailors and more? Are we looking at maybe is there going to be a sharing of resources outside the fence line? Where are we on that? And can you tell us?
No, they have the capacity, and over the last few days, they have expanded their capacity. They have been flying in medical professionals in the military to come in and handle this. And what I'm very happy about is those resources are going to stay and put after they clear and get the Theodore Roosevelt underway. Those medical assets remain and will remain to support the island of Guam, and actually would already be in a posture to actively support the government of Guam.
Right.
Speaking of flying in of medical teams, do you have any information about this strike team that is supposedly going to be arriving to Guam?
Well, I'm sure I'll get the update on at 10, but we have already known for days, and actually it's in response to the requests that we've been making over the last several weeks. Part of these requests are coordinated by our surgical unit or their medical unit of the Guard under Dr. Cruz, in close collaboration and with the lines opened by the FEMA team and our Civil Defense Office.
So what are some of
we've been we had already been tracking additional testing capacity, PPEs. And then making a hard ask for additional medical staff. And in fact, there are additional, even private medical resources coming on available as state of Washington and state of California have seemed to averted a big crisis.
What are some of the asks?
Medical personnel. In fact, I would just maybe tell you the governor's press conference at 1, she'll probably be making an announcement of additional equipment and supplies coming in from some other sources that have come online, partly with the support and facilitation of the military. But we've asked for beds for. Obviously the military responded and sent us about 34 ventilators with PPEs and even medicine. We also have a very good coordinated effort. We understand what's going on with the local pharmacy community. What are the drugs that are needed? Even thinking big over the next few months, making sure that people that have difficulties with access to healthcare or are filling their meds for all their maintenance drugs. Because on top of it, don't forget that we have a very unhealthy community. A lot of diabetes, a lot of heart disease, and those people need to continue on getting their meds. So that's part of it. The other side is coordinating all of the relief and the response efforts to people that are hurting right now because they are no longer living paycheck to paycheck. There's no check. And so the announcement the governor made about trying to get, being able to push out for about 10,000 people that are earning the lowest in the first wave to get some immediate help. is making a difference. I also have to say that DOE's feeding program has been an excellent filling the gap. And then, in the next few days, one of the most difficult, complicated issues has always been the homeless situation. And our instinct originally was to, try and see if we can round everybody up for their safety, and seeing some things happening in the States where, you have to, when you do that, you have to be very careful, because you don't want that to be a cluster in itself. So even when you're going to do sheltering and having a very structured sheltering program, there's some public health risks that we needed to resolve and address before we head into that direction. But you'll see us making some movement on that regard too.
Right, LT. I just wanted to ask, and I know you're well aware of what's happening out here in terms of just the numbers of the meals that DOE has provided. I believe it's 260,000 total since the start of this, and the lines, and people are waiting, and people applying for food stamps. I just want to ask, do you does that hurt you when you think about these people hurting out here, and that?
No, it's the top thing that I've been thinking about this entire time is, and this is even such a logistical problem, because you really need to discourage people. So when you saw the news where you saw all the people standing in line for the unemployment application in Florida,
right?
At risking their life. And part of it, so for us on that front, trying to get things out to people without, and minimize their risk of coming out, that's something that we're actively working on. And I would just tell you that that I feel that we're being very aggressive, but we're being very aggressive because, that each day that goes on, people's resources are less and less.
Do you feel their pain, Lieutenant Governor?
Oh, gosh, of course. I mean, I probably can't feel their pain as much as they are, because they're living it right now. But, I'm very worried about it. That's something that's the reason why we're in office, is to try and address that kind of thing.
Mm-hmm. And I think that's why, you may see us getting emotional about it, because we do hear from people out in the community every single day, whether it's over the phone or if it's messages on Facebook, and they really are hurting.
Yeah.
So
and that's why
I don't know how to impress upon.
Yeah.
So can I just tell you that there's other stuff going on, behind the scenes, and to what I have, I guess what I would say is, it's not obviously where we're at right now is not where we would like it to be. Where we need it to be. I think that we're trying to figure out innovative ways to push things. We even have a bunch of commodities that DOE brought in that we're distributing with them in some of the low-income areas right now to try and bridge it. And we even tried to get people in the hotel community maybe to try and do some food banking for their employees, but that idea got shot down by some people that thought it was a dumb idea. But we'll just keep trying. Like I said, I don't want anybody to think that we think everything is perfect. It clearly isn't. This is a unprecedented situation, but I just want to tell everybody that we're gonna continue to push and try and push things out the fastest way we can. And I would just tell you that if you're looking at what's happening in some of the other states, they're doing their challenges, but I think that I would just tell you that we're committed to trying to get these things out, and I think there'll be some good aid, at least for the people that are the lowest wage earners. Right. The group that is about to get paid are probably the ones that rely on tips more. People in food and beverage, they're hurting right now.
Hey, LT, I'd asked the governor a question yesterday about the tax refunds, and I kind of wanted to ask it again last time. But what I had meant was that I know that the court order says we got to pay him 6 months from filing, but nothing's stopping us from paying him sooner. Is that an option that's being looked at, paying out the processed tax refunds that people filed in January, or has this ship sailed since we're getting the governor's got her $11 million plan, and I know Daphne's.
No. I would just actually that is part of the push. Part of the push is to try and push those things out aggressively, and we'll get some details and get a path more in the next few days. But I would just tell you that I think that we're trying to be the most aggressive that we can.
Right. Going back to what you said about the DOE commodities. So today, grab and go meals. There's no meals today because it's Good Friday, and thank you to all the volunteers, the employees, everybody. Is there going to be maybe some kind of effort to help supplement what DOE is doing when they do start back up on Monday, or are we?
So the part of the planning with us is maybe about, I think the days are flying by so fast. Maybe about a week and a half ago, when we met with John Fernandez on Zoom, and and he talked to us about what can we do to step up and increase the number of meals. Because you notice that it's been going up incrementally. So I would say that we probably continue we maximized it, to maximize and as much as we can put out, and with the assurances that we're coming in and providing the bridge financial support to get it done, and that's been done. Right. Maybe when I touch base with him later today, I'll ask him what more can be done. But I think that to suggest.
Did we lose him?
Was something nobody's ever dealt with, at least in 100 years, right?
Right.
And I think we're pretty open-minded to try and push things out in a very aggressive fashion.
Nice. I got a comment here on Facebook. You mentioned the commodities. I had some relatives who were getting these back, pre-COVID. Is that program? I know you mentioned it. How close are we to making that supply available?
So some of that's happening right now, and I guess I would say maybe if you can ask them to call my office at 475-9380 to tell us what neighborhood or housing area their relatives are from. Okay. If they're living in public housing, in which village, there is a strategy that we worked out with DOE to try and get those commodities out to everybody. Okay. And so just have them call my office and let us know, just state the concern. I have, just a couple people that are still here, right. I guess, that are able to act on those kinds of things.
Right. LT, the phones, the public health, I don't know if it was just the system crashed because so many people were calling, but are you aware of have the phones been repaired? Have we taken care of that?
They have been repaired, and I would just tell everybody to, the best thing to do is to move it, use the 311 option, and make that connection. But yes, the public health phones have been repaired. That was the briefing I got last night around 9.
Okay. Have you gotten any briefings on the Department of Corrections?
Yeah, so I know that the CDC has been up there. I'm very optimistic with that situation based on how the director has been handling things and responding to these threats and concerns. We'll know a little later in a few more hours when we get the update, but the last indication I got yesterday was that all of the processes have been working. So I'll just say that Joe Carbolito, the director there, for about 3 weeks already adopted a process that the Bureau of Prisons put out, a protocol. And then behind the scenes, the court, the AG's office, my office, we have been talking and working on reducing the number of detainees up there to reduce the risk.
Right.
And of course, that reduction will be based on all the people that are up there for nonviolent offenses and trying to reduce the risk up there.
So when you say reduce,
the indicators that I think that those efforts are working.
So when you say reduce, you mean releasing them?
Yes. Or the judges will go in, take a look at the situation if it's nonviolent, and based on their living situation, they will make a decision to do a notice to appear instead of confinement.
Have you heard if anybody else has tested positive?
No, I haven't heard of anybody else.
Okay, LT, I'm getting a lot of messages from the families of inmates and detainees. They're saying that they haven't, visitation's been closed, but they haven't been able to get, needed supplies like sanitizers or whatnot to the inmates. I don't know if you can work out that, but more importantly, what would your message be to these families who are obviously having more anxiety because of this situation that's developing at the prison?
Well, I would just say that we have a medical team up there full time. As you know, we have a clinic up there. The last few weeks, they have been adopting some protocols to try and prevent the spread. And what I'll do is, I'll talk and find out what kind of how they could, if they're able to try and facilitate that kind of stuff to help. I'm not sure what the answer is yet, because, by reducing the visitations and trying to reduce the spread, there's consequences.
Yeah.
Access to people that are serving is not there right now. But even with humanitarian supplies, need to be screened, make sure there's no contraband. There's still, that's been an issue.
Good point.
Tough. We know it's tough. Yeah.
We'll have to, I'll raise it, and then I'll rely on the director to use his judgment to see what can be done.
I just kind of wanted to give you the opportunity to tell these families that, it's going to be okay, or this is something that you're looking at, right, closely?
Well, it has been. Actually, this was part of I guess because of the background I have at the court, and, one of our legal counsels used to be a prosecutor and a defense counsel, so we had already had early indications that we needed to make sure that we need to prepare for how corrections has to operate during this unprecedented crisis.
Right. LT, it's been go ahead.
Chris, I wanted to just say, though, that it's Good Friday today, right? So if you are supposed to be a good Catholic, practice being a good Catholic and stay home. But, I know Easter is a day that we're used to. There's a desire for us to be with our families. And unfortunately, this year, if you love your family, stay away from them. And I'll just give you my own example. I haven't seen my mom for, 3.5 weeks already. I see her on FaceTime. My nephew had his 8th birthday on Monday. I dropped the gift outside. I waved at him. You just need to sacrifice a little in as a matter of love. And so for me, obviously, I told you we meet with people, and you just never know what's going to happen.
Right.
So on Sunday, plan on WhatsApp, FaceTime, Zoom, whatever it is. A couple of my aunts are debating whether or not they should putty out what they would make, and deliver it. But I told them reduce being on the road. So
Curbside pickup, LT.
Yeah, I actually have an aunt that said she wants to roast a ham, cut it into 4, and putty it out 4 ways. But
wow.
Even that, it's kind of like, I don't know if you should be doing that. Why don't we just, save it for the future?
I know you're in a position. Can we redo Easter after all of this? Is that possible through,
I think that we should, can I just tell you, I kept feeling so bad for the class of 2020.
Yeah.
I kept thinking, gosh, no prom, no graduation ceremony. I think we graduate several thousand kids every year. A lot of different situations going on, but the only silver lining is they'll definitely never forget that they're the class of 2020.
Right, and then because my boy's a junior, but he was saying with his classmates. But I think one of the consolations, if it's any, I don't know if it is that this is happening around the world, and you're not alone. Right.
That's right. I'm curious if they're going to have a Zoom prom.
Wow.
Oh,
yeah.
God.
That would be
We'll see. opportunity will come.
Right. LT.
Well, anyway, you two, look forward to seeing you sometime soon.
I know.
Yeah, well, you can Zoom us.
Yeah,
if
let's
you
do
want.
a Zoom.
Yeah, I don't mind. Do you guys do Zoom on your show?
Yes.
We could, yeah.
Oh,
we'll
not
set it up.
this show.
Yeah.
Crystal, if you're doing Zoom, she said no, just phone call. Next time.
We're going to go on TV starting Monday, LT, 8 to 10 on TV 11. So we're going to figure out new
So
ways
is this your new morning show that has just launched amid the crisis?
See what? Yeah, exactly. Before this all started, we had no plans on doing radio. But when everything started to heat up, we met on a Monday. How are we going to do this? And I said, maybe we should just do radio. It's immediate. It's fast. And the following day, we were on the air.
Yeah, and so what it does, LT, is, KUAM, we've totally revamped all of our procedures in news and information gathering. We're operating with less than 10 employees in the whole building. We don't go out in the field. We conduct all of our interviews either over the phone or through Zoom. And so we figured this morning show would be a good kind of a meeting point for all the doctors, all the government officials, the people of Guam to kind of come here and put things out there that people need to know, and that was really
the whole idea.
Yeah,
I think it's very helpful. And let me just close by this. Part of the when the government of Guam is giving information in such a very rapidly evolving situation, really the expectation, what we're doing is trying to make sure that message gets out by the person that we've elected to be in charge of the island. And I just want to tell everybody that, yes, I am, managing this crisis, but wanting to make sure that there are clear messages. Sometimes I've seen the criticism, maybe sometimes the message didn't seem to be clear, but I'll just give you this. The governor is doing everything she can, and her experience as a nurse and her knowledge about that has allowed our government to kind of do things a bit earlier than other governments have throughout the world and throughout the states. And I just also have to say that she's managed to get the attention from the federal government, even though it's competing with so many other places. And I'm really confident that, we're going to do our best for the people. We're not perfect. We have made mistakes, but we will never stop trying.
And the phone is working.
Yeah.
Right. Got it. Yeah.
Well, thank you, Josh.
Yeah, man. LT, thank you so much. It was great. It's why we wanted to have you on. You got a lot of fans out here standing on our Facebook.
Enjoy your time with the very, people in your house.
Right.
I mean, this Easter is a new beginning of many sorts. Let's just try and remember everybody that we love and care for them.
Okay. Thank you, and happy Easter, LT.
And hopefully we can get you on again next week. Thanks, bye.
Yeah.
Okay, thanks. Bye-bye.
Okay, wash your hands. Oh, there you
He's
go.
so great.
Yeah, Lieutenant Governor Josh Tenora. You know what I really appreciate about the Lieutenant Governor is he's never shied away from admitting that we're not perfect, we made mistakes, and I think that's sometimes a problem that the governor has, and you see it with Trump. It's very similar. But it was really good to hear from him.
I'm glad he called in. He's doing fine. He gave us a perspective on what he and the governor go through every day with their 8:30 briefings, their cabinet meetings, and they have the press briefings. And it's good to know that behind the scenes, he's doing everything possible and working aggressively to get our island people the resources that we need.
Yeah, I feel like I had my fiber because I was so just backed up on wanting to know a lot of different things. And Lieutenant Governor Josh, really, I mean, because he's in the know and he doesn't have to go give it to someone else for them to, kind of decipher it and everything. So to get it straight from that source, I think it calmed a lot of people's nerves out here.
Yeah, I feel a little bit more calm.
Right. So let's move along. And, want to recognize some COVID heroes at the University of Guam. Dr. Tom Kreis. They were able to do amazing work with this telethon that they had. And we want to bring them on to the show from the University of Guam. Dr. Tom, good morning, Doc.
Good morning. How are you?
We're doing really good. First of all, thank you and congratulations. That telethon was an amazing success.
Yes, we're really pleased. We're so pleased to have the community turn out that way. It was really just way better than we were expecting. We're really pleased.
Yeah, and let's talk about the expectation that you guys had at the onset of this telethon. Realistically, how much were you looking at raising when you guys kind of kicked this idea around?
So our original goal was $20,000, and we were letting everybody know that we were trying to raise $20,000. And we're so pleased to have KUAM as a co-sponsor with IT&E and with LSG and a bunch of other supporters. So we wound up actually reaching the goal right before the telethon. And so Norm Analista, the co-host of the event with Charlene Santos Bamba, they raised the target to 30,000, and then it took about an hour. Then we raised it to 30,000, then raised it again to 35, and then to 40, and then in the end we got $43,478. So just terrific, and we're keeping up the donations can still come in if you're interested. So at give.uog.edu, you can give there, or IT&E and Docomo both have text message ways to donate as well. So
tell us about the 43,000. So this is going to go to support emergency medical personnel?
Yes, right. So we've got a dozen public health centers around the island, and our faculty, our nursing faculty and students are serving with other nurses and healthcare professionals all around at these dozen places, and including a call center on campus. So we've been supporting this whole crowd with food. So there's a piece in the paper today about we're up to 4,800 meals that we've delivered to those centers, a team of people from the university who've been doing that. And then that's with some donated food. We have chefs from GCC and from a number of restaurants and hotels all over the island who've been contributing, their cooking skills, and then some of the donated food and some money to buy food and so on. And so this will help continue that work. And then we're also making we're using 3D printers. We have 4 3D printers at UOG, and so we're making face shields. We have people sewing to make masks, along with lots of other people all across Guam. We're making these materials, and then also to buy the regular kind of masks, the medical masks, and the gowns and so on. And I emphasized during the telethon that to treat one person in serious trouble, you need 16 changes of that whole gown outfit every day. So you just multiply that. You just take the numbers of people we have and then multiply, and you see that you have to have a lot of this material. So it's not just one time we need one gown. We need thousands of gowns to deal with this. So we expect to spend every penny of this and more. And so, but this will tide us over for a while, and look forward to continuing this very generous donation spirit that we have. So.
Right. It just seems like you guys got your own little emergency response team.
You had me a 3D printer.
Yeah.
Yeah. It has been really cool to see that. We also have our chemistry faculty and our marine lab, because of the laboratories have isopropyl alcohol for preserving the specimens.
Oh, nice.
So we're making.
So you got a stash.
Yeah, so we're making the hand sanitizer, and so we've got a whole team. I just got news from Dean Margaret Hattori Uchima yesterday. She showed me all these pictures with they're doing different recipes of aloe vera and the alcohol, and then they're having the nurses sort of see which recipe that they'd like us to do more of. So there's that kind of work going on too.
Doc, is it spring break? Sorry, I haven't been in school.
Yeah, so our spring break ended last week. So this week was the first week that we were completely up online completely.
Right,
the spring break was week before last. So
nice. So that's been working okay for you guys, the whole online thing?
It's been a huge effort because, a typical faculty member will spend a semester, at least 6 months, trying to, convert a face-to-face class into an online one.
Right.
And here, our several hundred faculty members have just almost in an instant switched everything to online. So it's really been a tremendous effort. And the students, too, trying to, so many of them have not great internet connections or not great equipment. We've had donations of equipment from all the companies companies from Docomo and IT&E and GTA. It's been the whole IT world has really been very helpful, trying to get us better connections or trying to solve the problems of internet connectivity all over the island, and so they're busy trying to serve that as well.
Well, I want to appreciate, what you guys are doing. And, maybe a slight silver lining is, we're kind of behind the curve on a lot of things, and I know online was one of them. But, hey, because of COVID-19, now you guys know you can do online classes, and you have the capability.
Yeah, that's true. Yeah, we're trying to make the most of that.
Right, right, yeah.
Yeah.
So I just want to wish you a happy Easter, Doc.
Yeah, thanks, and to you, too.
Okay,
Yeah.
do you foresee having another telethon live stream?
So we're open. We're learning a lot from this. This was a bigger success than we were anticipating. So stay tuned. Yeah.
Okay. Well, great job, and I guess your final shout outs to everybody that helped put this together.
Yes, and so the co-hosts Norm Analista and Charlene Santos Bomba did a terrific job. All the co-sponsors, the Katrina Perez, the executive director of the Endowment Foundation, secured sponsors, and we've got just helpers from across Guam. It's really been a terrific effort. And then the whole thing will be aired again on Docomo TV next Tuesday and Wednesday at 10:30 a.m. Right. And then GNN TV will be broadcasting it on Tuesday at 10:30 a.m. Right. So if you missed it, you can catch that there as well. And we're of course taking more contributions to the effort, and 100% of the money raised is going to support our frontline healthcare workers. So there's more opportunities to give. So thanks to everybody who is part of this. Terrific. We learned a lot from our faculty and students and staff and alumni, and we had great entertainment, and we really showed what Guam can do. And so it was just a really terrific effort. So. All
right. Thank you, Doc.
Thanks, Doc.
Thank you both. Yeah. Okay. Thanks for co-sponsoring. Yeah.
Oh, yes, of course.
Happy Easter and wash your hands, okay?
All right. Yes, you too.
Okay. There you go, Dr. Tom Christ, University of Guam. Bathroom break.
Yeah, but first, just again, we are going to be broadcasting the telethon on the station's partnerships that we have with Docomo at TV1. That's Tuesday and Wednesday of next week at 10:30 in the morning, and also on GNN with GTA. That's Tuesday at 10:30 in the morning.
All right, we're going to come back. We're going to tell you all the mass schedules, on this Good Friday, and we hope you are having a good one. You better be good on Good Friday. All right, we're KUAM-FM. Haganya, Guam. Good morning.
KUAM News Updates are brought.
GU Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Today, the soldiers and airmen of the Guam National Guard are working hard to fight this coronavirus battle. You can help us win this war. Please stay home. Saga Gigimatmizu.
Joshua Manzanotnia. I can't wait for him to come home. Keep us safe and stay home.
I miss my daddy, and I can't wait to see him. So keep us safe and stay home. Dab.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Kids from Chook, 852.
Champagne and caviar, but no one ever showed me the river, and that really hurts.
Good morning. It's Good Friday. 852. Let's go recap the events in a session last night.
Okay.
With Sabrina Salas Matinati. Good morning, Bree.
Good morning, everybody. Lawmakers, they were in emergency session yesterday. It's the first formal gathering since the coronavirus broke out. Senators wore protective masks, gloves. Their desks in the Congress Hall were spaced out in compliance with the governor's social distancing executive order. There are almost a dozen bills up for consideration, and the session was punctuated by many short recesses as senators had to deal with a very limited supported staff. Most of the day was spent on the first bill on file, a measure by Vice Speaker Talina Nelson, who to provide hazardous pay, differential pay for frontline workers dealing with the current medical crisis. They also discussed Bill 336, which was authored by Senator Therese Chalahi, which would direct the expedited procurement of critical medical supplies to save lives on Guam during the pandemic, and specifically for the purchase of ventilators.
Madam Speaker, for point of information, as the previous colleagues have asked, the question is that has the governor already reached her transfer authority to transfer among the government of Guam? No, she hasn't. I just got off the phone with the Office of Finance and Budgeting. She's only transferred up to about 11 million. So she still has some authority to still transfer within the government of Guam. I'm in support of this bill with the intent of what it's for. Maybe with the author, maybe we can word it differently to basically tell the governor, you're authorized to transfer 4 more million within your authority to buy what you need to buy to protect our people. Because at this point, from the Director of Office of Finance Budget saying that if she reached her max amount, then if she needs the additional authority, then that's where we come in. And that's the information I wanted to provide to our colleagues. So she still has some authority to still move money. Okay, so I leave that to the author and to my colleagues. Thank you, Madam Speaker.
Thank you for the point of information. Anyone else on the main motion? Anyone else on the main motion? Senator Clint.
Thank you, Madam Speaker. So in light of that new information that was just revealed by the chairman of the Office of Finance and Budget, it seems apparent to me that the governor currently has this within her authority to purchase the items that we're looking to reauthorize again through this measure. So in light of that information, I'd like to make a motion to send the bill back to committee.
There's a motion to send Bill 3-35 back to committee. Is there an objection? There is an objection.
On the motion, Madam Speaker, I object very much to that motion. It just, I can't figure the mentality that would tell us that, first of all, if you've been following along with this pandemic, we needed ventilators since day one, Madam Speaker. We did not get ventilators. Only this week, the governor announced we're going to get 30 ventilators from FEMA. I'm so glad, because we have only about, I think, 20-some island-wide, and maybe only, I want to say 12, I can't remember the numbers now, maybe 13 at GMH, Madam Speaker, but we did not have ventilator capacity. And this week, we had Dr. Cabrera show the whole island what we are facing. And if we curb this pandemic 50% more than we are trying to curb it today, we might still have 700 deaths. And before people die of COVID-19, Madam Speaker, they can't breathe, and we need to put them on ventilators. And that's why we are fighting for ventilators, Madam Speaker, because our government has moved quite slowly in getting these, Madam Speaker, to be honest. Same thing with the test kits, same thing with the PPEs. Why at this stage are we having nurses crying to us about PPEs? And I don't want to take away from the efforts of these people who are working so hard. But I do want to make a point, Madam Speaker, with this bill that money should not be the option.
Point of personal privilege,
Madam Speaker. It should be
Speaker.
that the government puts the money in that we need to get this equipment, Madam Speaker, today, not tomorrow.
I apologize.
Point of personal privilege, Madam Speaker.
Is that a point of personal privilege, Senator Clint?
Yes, to be clear, the point making is that the governor already possesses this within her authority, so this bill does nothing. The issue is not a matter of cash. The governor has the cash. She has the transfer authority. The issue is a lack of ventilators worldwide. It's a worldwide shortage of ventilators. There's a worldwide shortage of personal protection equipment. You can just Google it. New York's asking for ventilators. Trump's telling New York they don't need ventilators because Trump doesn't have enough ventilators to pass around. Just watch the news.
Madam
it's
Speaker,
on the news
for
every
the
night.
personal privilege,
Thank you,
Madam
Speaker.
Speaker. If I don't know what this conversation is going to turn into when people are going to tell me to watch the news, because I watch the news every single day.
Senator
and I
Therese,
watch
please.
what happens at the hospital every single day and worldwide, Madam Speaker.
Please.
So I think that's really a ridiculous conversation
Please,
to
with
have
all
right
due
now.
respect.
And if I
I
may
will
say,
note-
it's not that money is not.
Senator Therese,
not
if
the
I may
issue, Madam
please,
Speaker.
with all due respect, Senator Clint, she does have a floor. I was checking with the clerk on motions to refer back. That is not debatable. I was getting a clarification on that. There has been a motion to refer back. There has been an objection. I must call for the vote. All those who are in favor to place Bill 333 back to the
Point
to
of
refer
information.
back.
Point of information, Madam Speaker, it's Bill 336.
I'm sorry, 336-35. Thank you for the clarification. There has been an objection. All those in favor to refer this bill back, please signify by raising your hand. Motion fails. Anyone else on the main motion?
Moved to the voting file.
Not back to committee.
Not back to committee.
That was
no.
crazy. That
So
was
session
crazy.
resumes on Monday at 9 o'clock in the morning.
Right, and I'm already seeing on some of the social media the nickname, the ventilator hater,
Hey.
Senator Clint Rigel. Yeah, that was just something else. I mean, following that logic, if there's a worldwide shortage of ventilators and PPEs, and the thinking is that, oh, why bother, because we're not going to do it, then I think we would see that across the board. We had Dr. Hoa on talking about trying to get more tests, but there's a worldwide shortage of tests, so are we now going to tell the doctors, oh, never mind, just wait?
Yeah.
So, very passionate plea there from Senator Therese Terlahi. And let's bring Nestor Leconte, who, of course, has been following this. Nestor, that was definitely one for the ages yesterday.
Yeah, that took place, that exchange took place toward the tail end of the session. Otherwise, it was a pretty boring session. So, like we were talking about earlier, it was punctuated by a lot of 5-minute recesses, and if you watch the legislatures, there's no such thing as a 5-minute
Yeah.
Yeah.
A 5-minute recess usually stretches out into 10, 15, 20 minutes. So,
And I heard that, what, point of personal privilege, Nestor. I heard that, I heard that it was because they were trying to figure out the logistics of what this, monumental historic session, social distancing session. So that, I don't know, that's what I heard. But it kind of seemed like, to us when we were watching, it was almost like, man, you guys been out of session for how many weeks? You'd think you'd head in a little more prepared. There was just a lot of like, oh, hold on, now we got to look at this. Oh, we got to read the bill. Like, you didn't read the bill yet?
Yeah.
yeah, they've got, they actually had 27 bills that I counted. I think that's been whittled down to 11 now, and 2 bills, including the one that Senator Terlahi and Senator Rigel were arguing over, is one of them. The other one was by Speaker Nelson's bill to provide for hazard pay differential to GovGuam workers on the front line. Originally, that bill had included private sector workers, but that was struck when by a motion from Senator Tello Taitigui, who pointed out that we need to get input from the businesses on how this is going to affect them, because that would be, of course, an additional cost to them, which at this particular point, they're already struggling. So that was struck. So it's only government employees on the front lines. And then they have 3 different categories, 25%, 15%, and 10% based on your exposure to potential COVID virus.
Can you kind of recap for us what happened with the Senator Regina Bisco-Liza bill? You know, people she had put this out after being noticeably absent on so many fronts with this COVID-19 response, and then it was like, hey, woo, here's some money, people. But so what happened? Because the bill was introduced, and then we saw the governor in the press conference yesterday. She floated her program for relief, and then how did that affect what was trying to be done with Senator Regina's bill in session, Ness?
Well, it's interesting because the Rules Committee puts out a kind of a session update after each session. And I was looking through it today, and I just noticed that under items for pending discussion, that bill, which would provide $400 and $800 direct payments to taxpayers. If you're individual, it's $400. If you're joint filer, it's $800. And then at the very bottom of that notice that it's up for pending discussion is an asterisk that said bill set aside 4920, which means they set it aside yesterday. So that seems to mean that they're not going to discuss it anymore.
Point of personal privilege, Nestor. Yeah, I actually watched that. It was after the press conference. The Senator Regina Bisco-Lee, she walked back into the session hall, and then she asked for it to be set aside in light of the governor announcing her $11 million proposal. We can go ahead and run the audio.
Yeah, we're going to run this real quick, Ness, just for our listeners.
Senator Lee, you are recognized.
Sujus Masi, Madam Speaker, during our lunch recess, millions of dollars in local government funds in order to pay out the first stimulus checks to individuals and children with an adjusted gross income range. Governor Leon Guerrero expects these payments to be made next week, and for these local funds to be the local funds used to be reimbursed as early as 2 weeks from now, when the entirety of Guam's share of the federal stimulus program is transferred. She has also made clear that using these funds will exhaust all available cash that won't jeopardize GovGuam's response to the ongoing COVID-19 health emergency. With all of this in mind, Madam Speaker, I want to thank you and my colleagues for your support of Bill 340-35 COR. Madam Speaker, this measure, entitled Recovery, Income, Support, and Empowerment, the RISE Act of 2020, it's important to acknowledge the work of so many of our colleagues who have been working day in and day out for a way to offer locally funded economic relief to suffering families while we wait for federal assistance. Madam Speaker, I want to be clear. The road ahead is unclear, and things may change that will once again require this bill to be a bridge for our families. And I'm committed to keeping this measure alive so it can be an option to exercise. Perhaps it won't be the first local assistance that we pay out, but it may be the one that's used when we need it in the future, when our people are in need and we have the cash to pay for it. But with stimulus relief finally moving forward and with local dollars being...
Committee.
I don't know what set aside exactly means technically.
I know. I don't know.
As Senator Regina explained there, she wants to hold it in case it might be needed in the future. But I think, as she said, the governor's announcement precluded that bill from, at this point, going through. So.
Too bad it had a really cute title, though. I know they probably took a little bit to come up with that. No, so Ness, and can you kind of give us a little more info on the governor's plan that Senator Regina was referencing?
The plan, I think, we talked about it yesterday, is that she's going to front $11 million that's now coming from the federal government to pay for the most needy families those with incomes of $10,000 annually or less. And so they're going to try to exhaust as many as they can, pay out as many of that $11 million as they can, as they wait for the federal stimulus checks to start arriving. Will be issued, by Department of Revenue Tax, because they said that the Treasury is going to pay the money to Revenue Tax, and Revenue Tax would be the one to distribute that within a couple of weeks, 2 to 3 weeks, according to the director, Daphne Schumacher. So,
and we had her on, was it like last week, and she said that in knowing that this was probably going to come down the pipeline, that she had already begun preparing the list of people who are, and it's a lot of people, $130 million, right, Ness?
Yeah, $134 million is what they are asking, because they had to justify that. And Daphne and her team, according to the governor, were the first ones to submit the implementation plan to the IRS.
Thank you, Daphne.
Treasury. Yeah, so kudos to them. So that put us at the front of the line, and hopefully they're hoping that money comes as soon, and then they can start cutting checks. And I think she said yesterday when she was brought up at the governor's news briefing that they're using the 2018 tax return. So if you filed in 2018, that's the information that they're going to go by in qualifying you for these $1,200, $2,400, and $500 payments.
Right.
$1,200 to individuals, $24 to joint filers, and $500 per year.
So there was an FAQ sheet that she had put out yesterday. I know that's up on our website, and I think we might maybe pop it in the comments here, but it includes the answer to questions. We're getting a lot of questions now. People who didn't file in 2018 are now asking, how do we file? So there is a process that Revenue Taxes are laid out that, of course, complies with all the social distancing, government shutdown stuffness.
Yeah, and people who did not file for whatever reason in 2018, I think there's provisions that, but you'd have to contact Revenue Tax on that. I'm not sure how that would work. So you could identify yourself as a taxpayer, and they'll figure out if you're eligible for the payment.
Yeah.
Point of personal privilege, I think Bree's going to talk.
No, I was just going to say that, Daphne went over that in our interview last week that you can find on our YouTube channel for people who are wondering.
Yeah, Ness, something, and I don't know how familiar you are or if this is even something that is feasible, but people are now wondering, since the checks aren't coming directly from the federal government, if the program is going to hold true on all levels. So what we've seen in the national scene is that the only way that thing is getting garnished is if you owe child support.
Yeah, I think that will be the only garnishment. Otherwise, you'll get your $1,200, $24, and $500, and that's tax free too.
Right, and so people making comments, so they've got bills with the hospital, they got bills with that. This money cannot be applied towards paying those bills. Is that accurate, Ness?
That is correct.
Okay, well, there you go. Ness, I want to let you know we got a comment about you here. I got to go back up, but it said Nestor Lecanto is the Walter Cronkite of Guam.
I think they're talking about my age.
Point of personal privilege.
I'll take that as a compliment.
Right, yeah.
All right.
Ness, thank you so much, man.
Thanks, Nestor.
Okay, there you go. Nestor.
Happy Easter.
Yeah,
Happy
you
Easter.
too. Wash your hands.
I will.
Okay. Nestor Lecanto from the KUAM news team. Always great, man. I'm telling you, he's got that experience.
Yes. So glad to have
I'm
Nestor.
so glad. Yeah, we're going to get Adriana Cotero on the show to talk about what she's been working on and following for you guys. Let's get Ken Nicholas on here from our digital team.
Ken?
You can follow him on Instagram, Ken Sanity.
Hi. Good morning.
So you're going to kind of run through what we got. There's a lot of Easter stuff that's going on our social media
Definitely.
stuff.
Definitely. With the lockdown and the quarantine, can't have the Easter egg hunt with all the kids. So last year, we did our first ever virtual Easter egg hunt. It was a little fun, little Instagram game where you click on different. There's a big photo collage, and you click on the different photos, and there's an interactive game that you can play. This time around, we have a bunch of different activities. If you go to our Instagram page, you can find our virtual Easter egg hunt. And what it is a series of 4 pictures. And on each picture, there are 10 animated or like 10 cartoon objects that are hidden in the picture. So you just need to take a screen grab of each photo and then circle all the different objects. And then you send that to us, tag us in your story. And if you get all the items, then you are eligible to win a prize from our partner with this, which is IT&E. So there's a couple of giveaways that they're procuring for us. So definitely check out that contest. It's on our Instagram. But also on KOM News, the website, KOM.com, you'll also be able to partake in a bunch of other stuff. We have our coloring sheets, like we did the coloring sheets earlier last week. We have new ones for Easter. We have like a Carabao wearing bunny ears, and we have some eggs that you can hide around the house, and we have a cross. So little easy activities for the kids. And we are also doing a little Instagram game called Show Us Your Sunday Best. I think Easter is one of the times where everyone wants to wear their nicest church outfit. And since everyone is on lockdown, we'd like it if you take a selfie of you in your Easter getup and DM us at KOM News, and we'll put it up.
All right.
Yep. There you go.
Hey, we got a lot of comments, right? Oh, you want to do those later?
We have comments.
Okay. We do. Yeah, we got comments. We'll do it later. Bree's got her news thing. She's going.
Oh, no. I wanted to just add to what Ken was saying that today, Good Friday, live at 2:30 p.m. on KUAM TV 11, we will be broadcasting Mass, and it will also be streaming on our Facebook page. Then on Easter Sunday, we are also going to be broadcasting Mass at 9:30 in the morning on TV 11. And once again, because we are a multimedia company, we will also be streaming that off of our Facebook page.
Okay. We're going to do national news now with Sabrina Salas Matanani. It's 9:15.
Okay, well, first let's start with what's happening with the USS Theodore Roosevelt. For people who aren't aware, the Vice Chairman of the Joint Chiefs of Staff early this morning, Air Force General John Hyten spoke at the Pentagon about the status of the spread of the coronavirus on board the USS Theodore Roosevelt. And he spoke this morning, as I mentioned, because Chris is, I'm not sure what he was doing.
Not a good idea to think that not a good idea to think that the Teddy Roosevelt is a one-of-a-kind issue. We have too many ships at sea. We have too many deployed capabilities. There's 5,000 sailors on a nuclear-powered aircraft carrier. To think that it will never happen again is not a good way to plan. What we have to do is we have to figure out how to plan for operations in these kind of COVID environments. And so when you look at the numbers off the Theodore Roosevelt, we've tested almost the whole crew now. We still have about 1,000 tests left to report out, but 3,170 of the crew tested negative. 416 have tested positive. 187 of those were symptomatic. 229 were asymptomatic. We still have 1,164 pending results, and we've now had 1 hospitalized and 1 in the ICU. So this is an interesting set of data. It's interesting for the country, but it's interesting for us. We have to figure out how this impacts our population, which tends to be a very young, healthy population.
Through the details of how they do that.
So, from a broad perspective, the sailors that are off the ship, there's 2,700 sailors that are off the ship now. If you think about 2,700 people going on to an economic structure the size of Guam, that's a pretty significant impact. So those sailors are all over the island. They're in houses, they're in hotel rooms, they're in different places, and there are teams of medical professionals that check on those sailors twice a day. And that's the procedure that the Navy put in place to make sure we walk through that. That's the procedure that was followed. And sadly, this morning we had our first hospitalization of the one sailor. I guess deep down, I was hoping that we would never get to the point. I was hoping that the numbers would be 0 at the end of this, but that's just not going to be the case with coronavirus. There's always going to be the 1 or 2 that come in, even in our demographic, and that happened for the first time this morning. So we're hoping that sailor recovers. We're praying for him and his family and his shipmates. But the Navy put together a good plan
All right, that was the Joint Chiefs of Staff Vice Chairman, Air Force General John Hyten, who had a briefing this morning at the Pentagon. They still have 1,000 tests left to report out for the sailors on the Theodore Roosevelt. More than 3,100 of the crew tested negative. 416 have tested positive. 187 of those were symptomatic. 229 were asymptomatic. They still have more than 1,100 pending results, and they now have one hospitalized and one in the ICU. 2,700 are off the ship. In national news, there's a new model that's out today that shows fewer Americans will die of COVID because of increased social distancing. But it comes after another day of record deaths in both New York and California. Nationally, there are now nearly 15,000 deaths and 432,000 reported cases of COVID-19. Michael George reports.
A day after New York lost at least 780 people to the coronavirus, and a new report finds the national strategic stockpile is all but depleted, there's new optimism that COVID-19 will claim the lives of fewer Americans. A widely cited model from Sunday predicted at least 81,000 people will die by August. Just 2 days later, that projection has dropped to around 60,000. But on CBS This Morning, Dr. Anthony Fauci from the National Institutes of Health warned this is not the time for Americans to ease off on social distancing.
We've got to continue, in many respects, to redouble our efforts at the mitigation of physical separation in order to keep those numbers down and hopefully even get them lower.
Researchers from Mount Sinai say testing shows most of New York's cases came from Europe, not Asia. The Trump administration barred Chinese nationals from entering the country in February, but Europe didn't face similar restrictions until 5 weeks later. Person-to-person spread is still rampant in some communities. Chicago's Cook County Jail reportedly has 400 active cases, the highest number of cases that can be traced back to a single site. Although many nonviolent offenders have been freed, protesters are demanding a mass release of inmates after one died from COVID-19. At this prison in Monroe, Washington, prisoners and their families demonstrated about the conditions inside.
My husband is asthmatic and he has COPD. He's been 5 days without an inhaler.
And at this California Bay Area nursing home, 59 residents and staffers have tested positive. 6 have died. And sick employees say they're being asked to come back to work.
They told my wife, you can come back to work, just have to wear a mask and be careful.
And in Southern California, 84 patients were moved from a nursing home with 39 confirmed cases after employees refused to show up for work for a second straight day. Michael George, CBS News, New York.
Information Center reporting out last night at 10 o'clock that we have a total confirmed cases of COVID-19 at 128.
All right, and it's something we didn't get to talk about all morning. I was crashed out, but apparently there was another falling object last night. A word from Jenna Gamindi. Of course, they said it was a Chinese, something to do with Chinese launching something, but obviously they're going to have more info on that today. So I just wanted to mention that because it was all going all over social media. I woke up and I was like, oh.
Yeah, I saw that too.
Yeah.
Trying to see if there was anything new that came out from
Right.
Jenna.
Yeah, I don't think there is. I think they're going to push something out later.
Okay, yeah. A Chinese Long March 3B rocket was scheduled to launch the Palapa N1 communications satellite, also known as Nusantara Satu, from the Zhejiang Satellite Launch Center in China.
There you go. Added level of anxiety. I don't know if it was just the one video that was going around, but it was nice to hear CCR early in the morning. 9:22. Hey, it is Good Friday, and I want to thank we had Father Paul Goffigan and Father Richard Kidd on the show this week to kind of just address the audience. During this very, very obviously it's a very spiritual, religious time, and also extended an opportunity to Pastor Mark Beneventi of Life in the Sun. I've heard him preach and speak at a few things. I know that he had been doing some stuff with the legislature, and so I wanted to bring him on to kind of first of all, good morning, Pastor.
Good morning, Chris. Thanks for having me on the show.
Of course. We also got Sabrina Salas Matanani here.
Oh, hi, Sabrina.
Hi, how are you?
Yeah, I'm good.
Pastor, so I just want to ask, how have things at Life in the Sun been affected by COVID-19, and then in what ways have you been able to continue to preach and bring the word to your followers and your flock?
Yes, well, like the rest of us, we are practicing social distancing. And so we're no longer gathering on Sunday mornings, and we have moved to an online format. And very thankful for the technology to be able to do that. We're doing it not only on Sunday mornings, but also in our small groups throughout the week and various other meetings. And so, although we're isolated by space, we don't have to be separated in spirit. And so we're continuing just to do all that we can in a creative way because our relationships are important.
So what are some of the creative ways that you are continuing to communicate?
Zoom has become such a popular app, and so that's been a real good tool to be able to stay connected with people. And there are various other applications that can do the same thing. We're just making use of all of them to continue to stay in touch with each other.
So do you hold services over Zoom?
We're using Facebook Live for that.
So similar to what the Catholic Church is doing.
Yes. Yeah, that's a great platform, and that's worked really well for us.
Right. So, Pastor, let me ask you, it's pretty much Christmas and Easter, the two biggest times of the year where we really think about Jesus and, his message and his life and what the Bible teaches us. So how have you guys been able to process that? I mean, with all this stuff going on, I had Lieutenant Governor Josh Norrie on the phone. We made an agreement we're going to redo Easter later. But just dealing with that, how are you guys processing that as a church?
Are you meaning how are we celebrating Easter week in light of social distancing?
Oh, yeah, just say, sure.
Well, as I mentioned earlier, we're using online tools to be able to stay connected. And so just yesterday we pre-recorded the message for Easter Sunday. And we actually are having communion online, and we've put out a notice to everybody in the church to just prepare their communion elements at home so that we can share in that time together. It's very different. It's a little strange celebrating Easter this way. But, I think what's important is that the message of Easter, God's love and forgiveness, is still being celebrated in hearts and homes.
Pastor, I could just get right to the point. I wanted to know if you had maybe a Good Friday, an Easter meditation, or maybe a passage or just some words to put out here to our audiences.
Sure. Today, Good Friday, it's interesting in light of all the bad news that we're hearing. Today's Good Friday. It's the day we remember how Jesus took our place to pay the penalty for bad things that we've done. And if you've seen the movie The Passion by Mel Gibson, you see a close-up of what that was like. Good Friday is symbolic of what's going on in the world around us, especially with COVID-19. And the symbol is things often get worse before they get better. Yes, Jesus was crucified, but 3 days later he rose from the dead, and proving that he is the Son of God and offering forgiveness and salvation for everyone. And the message of Easter is that with God, there are better days ahead. Whether it's COVID-19 or life in general, God's word is clear. We will go through difficult times, but with him, there are better days ahead. And Chris, if you don't mind, I'd like to speak to your listeners directly about experiencing God.
Pastor Mark, I've given you the floor. Take it away.
Some of you who are listening, perhaps you feel as if God has been trying to get your attention recently. Perhaps you're out there somewhere and you just feel like something is missing. And you're sensing it might be a relationship with God. And if this describes you, today is a perfect day to do something with what you're feeling. It may be time to make a decision. If you've never made a conscious choice to invite God into your life, if you've never made a formal decision to say, yes, God, I would like to experience you, and yet it feels like now is the time, then I'd like to give you an opportunity to do that. The most important thing is that you really want to, that you make the decision. And then the next step is simply expressing that decision to God, which is called prayer. And so if this describes you, what I'll do is I'll pray out loud, and you can join me wherever you are. God will hear you. And so if this is you, wherever you are, let's just take a moment and pray. Father God, yes, I realize you've been getting my attention lately. I also realize the way I've been doing life isn't working so well, or for whatever reason, it's just not enough. And I realize something is missing. And I'm realizing it's my relationship with you. And so today, I'm making a choice. I'm making a decision to choose you. And so, yes, I'm opening up. I'm inviting you into my life. And I want to experience you. And so I ask you to come into my life. I ask you to forgive me for all the bad things I've done, even things I'm not fully aware of. I ask you to forgive me. I thank you for Jesus and how he took my place on the cross. And if you're praying this prayer right now, I invite you just to take a moment to let him come in by faith. Just take a moment to receive him. Everyone who receives him becomes his son or daughter and begins a new relationship with him. And so, yes, God, I receive your spirit into mine. I ask you to change me and make me the kind of person you designed me to be. I ask that you would show yourself to me and teach me your ways and give me a new start. And I pray these things in Jesus' name. Amen.
Amen.
Amen. Well, Chris, I think that's probably the best Easter message that I can offer to all those who are listening in the midst of all the bad news, the tension, the fears, the anxiety. I know that no matter how bad it gets, the presence of God is more than enough.
Thank you,
for
Pastor
that
Mark.
message.
Yeah, that was.
People need hope these days.
Appreciate it. I know that your words are very powerful, Pastor Mark. I really appreciate it.
You're welcome.
Happy Easter.
And happy Easter, okay?
Happy Easter to you too. Take care.
All right, there you go. Pastor Mark Beneventi from Life in the Sun. It is a holy and religious time, and, I just wanted to give the opportunity to the priest and to Pastor Mark to come on and, spread the gospel, because that's something we'd be doing, and we are continuing to do. Even with all this COVID-19, of course, Good Friday. This is one of the big Catholic days, and we have schedules of masses.
So at 2:30 this afternoon on KUAM TV 8 and TV 11, we will be broadcasting a Good Friday Mass. Again on TV 8, TV 11, and also it'll be streaming on our Facebook page. That is at 2:30. As for Easter Sunday, we will be broadcasting the Easter Sunday Mass both on TV 8 and TV 11. That is at 9:30 in the morning. It will also be streaming on our Facebook page. So Mass on both days. Today, 2:30 p.m. and tomorrow at 9:30. I'm sorry, not tomorrow, Sunday at 9:30 a.m.
Okay, and let's go over to the Village of Petey. One of my favorite mayors, Mayor Jesse Allig, will bring him onto the show, and he's got a great program. Morning, Mayor.
Hi, Mayor.
Good morning, Sabrina.
Hi.
Petey residents, your mayor's on the line, and Mayor, I haven't heard about this Grocery to Go program, but I'm very, very interested, and I'm sure our listeners are as well. So what do we have?
So, I'm calling because I just, I kind of wanted to dispel some of the rumors. This all started when we were preparing for the pandemic a few weeks ago, and we were helping residents, or our Manamco and our most vulnerable population, pick up groceries and supplies so they could stay home. and I was noticing a larger need. And, you know, most people know what kind of items they prefer, brand, and so on and so forth. And my staff and I are the ones, we're the ones really going to the store and doing all the shopping. So on top of delivering student meals and Manamco meals, the shopping became, you know, a little cumbersome. So it took up all of our, you know, our entire day. So I reached out to Payless, and they actually were already contemplating something like this. They were talking about a program similar to what I was requesting. And so Mike was, you know, gracious enough to say, well, let's try it out. They worked out some of the kinks, and we decided to pilot it in PD. And so it's not we don't have a Payless in PD. And Payless didn't call me to, you know, I only want PD. I think Payless was willing to do it because we have a small population.
Right.
And my office was, you know, I'm always wanting to help our residents be safe. So, you know, I hear it all the time, you know, stay home. So the more we can let people stay home, the better. Everyone stays healthy. So it's, we just started the program, the actual program, Grocery to Go, yesterday. And it's a real simple process. They fill out a grocery list and submit it to us, and I turn it into Payless. They fill it, and the following day we pick it up and deliver it. Payless does not deliver the groceries. The customer can pick it up curbside at Mighty Payless, or you know, I can pick it up for them and deliver it to their home, which is, you know, for us it's preferable, so that, again, they could stay home. And so that's our Grocery to Go program, and I think it's, for me, I'm thinking, gosh, this just needs to go beyond COVID-19.
Right.
It's a great deal. And, you know, they do it in the States.
They got it in the States.
How many Manamco do you guys have participating?
Well, you know, okay, so how do you you cannot really discriminate, right? And so I hope Payless is not listening to me, but so we don't make it, we help all the residents.
Okay.
So we've, in the beginning, it was really only for the Manamco, but you know, everyone, we're all vulnerable, right? We're all susceptible to the virus. So again, we have a manageable population, and I have great staff. So you know, it works out for us.
Yeah. All right.
But yeah, that's I kind of wanted to share that because my cell phone number is on the grocery list, and I think everybody got it. And so, you know, I was. It was Holy Thursday yesterday, and it's a real Good Friday today.
Yeah.
So I'm okay that they call, but I just wanted to come, you know, to you because you are the number one station, and so hopefully everyone does hear that, you know, it's not really it's a pilot program, and Payless was again kind enough to help us with this, and I think our residents are grateful as well.
Definitely.
So, and then I do have to say though that if a resident wants us to go to another store, like Day by Day, because Day by Day is in PD, we will certainly go to Day by Day for them.
Wow. Okay. Wow, Mayor, that's good to see. Glad to see you're still working in this COVID-19, and we haven't caught up with you. Just real quick, how are your residents dealing with this COVID-19 crisis? Are they following the orders? Is there anxiety? What can you tell us?
I think, you know, for the most part, they're following the order. I did talk to someone about the Manamco feeling a little nervous, or not feeling comfortable being alone, or being with the same person that they live with, not being able to see grandchildren, and so on and so forth. But you know what? It's not like that, and I don't really hear that here in PD. I think everyone is understands the ramifications and stays home. We communicate. Most of them have my cell number, so they call me, and we have a little, you know, chit chat, and so I think we're all good for now. And we don't have a lot of large roads through PD, so we don't see a lot of traffic through the village or through Nimitz Hill. So that's a great thing.
Right.
But I do want to share something
because
it was it really caught my attention. I was a little emotional about it, but I think the resident's about 88 years old, and she called me the other day, and she says, you know, boy, this is worse than the war. And I thought, how could this be worse than the war when, you know, we kind of have the comforts of home. We try to service as many residents as we can. Our local government is relying on federal help. I guess, we're going to get it sooner or later. But how could it be worse than the war? And she says that during the war, she can hear when the bombs are coming. She can hear when the planes are coming. She knows when to hide. She knows when she can go out. There are signs. But now it's just super quiet, and she just has to stay home. Yeah. And so I was trying to understand her point of view, but it kind of caught me off guard for this, elderly, for this uncle to tell me that this was worse than the war. And it's definitely a holy week for the history books. Mm-hmm. But something that we can learn from, I guess.
Yeah, because that we just had this with Father Richard Kidd yesterday, where he was talking about how the Monumco made it through the war, and we need to put their struggle in perspective. And to hear Monumco say that, we got to take this serious, and we have the power to kill the curve, right, Mayor?
Amen. I believe, and I think all of what we're doing now. For those of us that are being proactive and doing things to help each other remain positive and stay healthy, I think we'll come out of this a stronger people, like we always have.
Thank you so much, Mayor.
Yeah, Mayor. Mayor, and I know.
Go ahead.
Point of personal privilege.
Go ahead.
I know you're a very faithful man, Mayor. So, and I know you'd be Eastering very hard this weekend. So, I just want to wish you, good luck and a happy and safe Easter. And I'm curious, how are you doing Easter with all this that's going on?
Well, we're going to rely on Hangouts and Zoom. So I live alone, so I talk to a lot of people. My phone is charged all the time. Everybody thinks I have nothing to do, which is great, right? Yeah. So someone to talk to throughout the night, which is great. But that's what we'll be doing, and thank goodness for the Facebook Lives and the ceremonies on TV. I really appreciate it.
I know you had reached out to me about the masses a couple weeks ago, I think. I can't remember anymore. Yeah. And so it happened.
We don't know the days anymore, right?
I don't even know. Yeah.
Well, and honestly, I hope it continues beyond Holy Week and beyond the Lenten season, because I think it's a great opportunity for all of us to be faithful. Mm-hmm. If there's nothing for them to do or nothing else for them to do, perhaps they can continue to pray and listen to your show beyond COVID-19.
Thank you, Mayor. Thanks for the plug.
Mayor.
Appreciate
you. Have an happy Easter.
You too. Happy Easter, Mayor. Wash your hands.
I told you too.
Man, that's your mayor, PD Mayor Jesse Allig.
Give it up. Yay.
Hey, man. 9:40.
Grocery. Say it for me.
Groceries to go?
Groceries to go.
Right, and so it's a pilot program in PD. You guys just get a hold of your mayor.
Mm-hmm. I was getting it confused with Grab and Go, which, by the way, everybody should know there's no Grab and Go for today. On Good Friday.
I got a call earlier. A guy is asking about it. There's no Grab and Go. Hurts my heart, and that's kind of where I was coming from when I asked the governor yesterday about, how she felt about people out here who are hurting. So our prayers go out to you, Salvation Army, the food bank. We know they're up and running today. Not so sure about Catholic Social Services. But let's go from PD, hop on an imaginary airplane.
Where are we going?
We're heading north to the CNMI with our correspondent who's currently on Saipan, Tomas Magotnia. Good morning, Tomas.
Good morning, Bree and Chris.
Hi.
So there's definitely a lot going on in CNMI. It's not going to be a good Friday, as we got to just go ahead and start. What do you have for us, Tomas?
Yeah, so far we know that exhaustive list of employees to be furloughed are submitted to the governor's office here in the CNMI. They expect that those letters will be sent out to the departments very soon, in the next couple of days, and not long after, of course, taking effect. And with this growing economic crisis, it's worsened by the coronavirus. The CNMI government, as we've reported, and previously, is cutting its personnel costs by 50%. We also got word yesterday from the press secretary of the CNMI governor that the office is looking to for its employees to being eligible for the pandemic unemployment assistance program. Also, as we reported last night, the public school system is facing a payless Friday today. On Good Friday, the Education Commissioner, Dr. Alfred Ada, issued that memorandum explaining that the public school system, and now we know that number is right over 800 locally funded employees, are there's simply no money left to pay them. I think it's also another update is on the containment response. The construction work continues on a field hospital at the Commonwealth Healthcare Corporation's upper parking lot in Navy Hill. They're reporting that it should be ready this weekend. The governor last night in a Facebook video saying that a project like this would normally take 2 weeks, and it's going to be completed in a matter of days to supplement the already existing facilities. And as of the latest report, there are 11 total confirmed cases in the NMI, including the 2 deaths. And that last report from April 8, I believe, says that we're waiting for 6 more specimens. And so to date, CHC, from the latest numbers from April 8th, is they've collected 45 specimens so far. I think it's also important, I want to share on the radio show the local hospital's mental health support hotline that's available Monday to Friday, 7:30 to 4:30. So for those in the CNMI, that number is 285-1856 or 1857. Again, mental health support provided by the hospital, and helpful tips during this crisis. That mental health care line for the CNMI is 285-1856 or 1857. And Brain Chris also wanted to share, I know yesterday we talked about it, KVM News will be speaking with the Northern Mariana Islands U.S. Congressman Kilili about the CARES Act and the federal response to COVID-19. Some of the things that we'll be asking him is the timeline for aid. I know a lot of people are asking, even if it's passed, what does the timeline look for it to be, put into their pocket? We're also going to ask him about any other legislation in the works at the national level, and we're also curious to know how he's working with the other delegates from the other territories to support their constituents. So we're waiting for that. I believe that's next Thursday, our time at 10 a.m. Viewers can tune in next week.
All right, thank you.
Tomas, just real quick, can you clarify, have they had any these Zoom-type press conferences up there in the NMI that we're having on Guam?
So it's been, the last one was the one that Bree and I were on, actually, so that's about 2 weeks ago. And, I've literally messaged the governor's office every single day asking, is there a press conference today, later this week? We know today's Good Friday, so there's limited working hours, and none for some. But, we're told that they're working out Zoom. The response we're getting, I don't know how much of a technical difficulty they're having there, but we're pushing for that every single day, and I'm not the only one asking for it.
Right. Yeah, I just wanted to give you an opportunity to address that, Tomas.
I that's the first message I send every day. I said, is there a press conference? Once I wake up, that's the first thing I send. So.
Yeah, it's kind of ironic because I think we went through that early on when the governor announced the first confirmed cases for Guam, and it was like a couple 4 or 5 days. We hadn't heard from her, and then finally the press conferences started to occur. So good luck with that. But I did want to ask you I wanted to ask you about the PSS employees. You said that was 800. Are they all teachers? Are you aware?
I'm not aware of that breakdown. I do know there might be roughly 500 teachers based on one of the information I got. I'm sure that information is online, but we're hearing now over, about 800. I'll look for that breakdown and give it to you. The point being that this is just not a good situation across the board.
Right, Tomas. So is there any assistance available? What are these employees going to do? Is there any media? Do you guys have a food bank there? Is there any kind of quick cash type assistance?
Yeah, other than the things we've reported on, I'm going to get an updated list. I do know I've seen the community come together on Facebook. There's a Saipan COVID-19 Facebook group with about 5,000 people on it, sharing resources, kind of, some good citizen journalism happening there and community support. But other than that, that's what we're also hoping to get from the congressman next week in terms of what that might look like on the national level for the territories.
Okay. Well, hopefully you can get some questions in about, Guam, because that would be great.
Yes, for sure. And, I'm definitely going to ask him about anything happening he might be hearing from Guam's end, but also, trying to get a hold of the Commissioner of Education here to get a better sense of what's happening at the public school system right now.
Tomas, Rhoda and Tinian, you have any info at all on that? Just how they're doing?
No, not of late. We know that there's no confirmed cases on Rhoda or Tinian, and again, as Esther Moniz shared, they're working on, the preparedness plan is in place for what's going to happen there if a confirmed case is found. But right now, the latest info we have is from that big release on the 8th, so we're waiting to hear more.
How's your family in Rhoda, Tomas?
they're fine. They're they're staying indoors. Actually, my dad sent me a photo, and he doesn't have a mask. One of those personal masks. So he was using this one of the masks for like bush cutting to go to the store. And so I thought, he's taking it seriously. People are staying home and definitely practicing social distancing as much as they can.
I have one of those masks.
Yeah, Bree, she was going to wear it the other day, but it just kind of looked weird. I felt like I was going to get robbed.
I mean, I heard that you guys are going to go on TV next week, so maybe that'll make for some good visual.
Yeah, I'm going to get a face shield.
Oh man, I want one of those.
I think we'll stick with the mask. And, I want to call out all the businesses again. I'm not calling them out, but just to be clear, the governor's executive order mandates that all employees of all businesses and their customers wear the masks. And I want to specifically direct this to our local media colleagues. I see some of you guys are not wearing your masks. You got to wear your mask. We're on the front line here. We got to set the example. Masks up, right, Tomas?
Definitely. And, I just wanted to share because, Jason, I know I did my interview with Esther last week, and he said, "Where's your mask?" And I was like, "I've literally not left my house." So I'm doing this interview from the room. So, I don't, as Esther was saying, we don't want to take those PPEs, but I do, going to try and make some homemade ones. But, yeah, definitely good to model that.
Okay, Tomas. Hey, appreciate it, man. A happy Easter.
Happy Easter. And, Chris, I just want to say, I listened to that WhatsApp recording for your Holy Week song. And I think you invented ASMR. I think you got to take credit for that.
Yeah, Bree, we're going to get that on to close the show, just to give people a little something lighthearted.
Yeah, I was listening to it. I was like, I think this is ASMR.
Thank you, man.
Yeah, all right.
Hey,
Take care.
God bless you, Tomas.
Looking forward to your interview.
Yeah, are you excited about that? On a personal note, I know you've interviewed Congressman Khalili before.
Yeah, he's great, and we are coordinating the times. It's going to be, I think, 7 p.m. in D.C. for him, Eastern time. So, he's definitely willing, hoping to get out the word, and we're coordinating with the staff to make sure we have at least half an hour with him to ask him all the questions. And for the viewers listening, if you have questions or concerns, definitely put them on this comment stream, or send them to tomas@KUM.com. We definitely want to hear from everyone.
Yeah, and I think, Congressman Khalili obviously is very, very experienced, and, our congressman has made a lot to do about being mentored, and I think, hey, you got a mentor right there, someone, our neighbor to the north, and I really would like to see a partnership there, Tomas, so when you ask about that, I'm going to be listening up for that answer, because I think that would be something that we would really, really benefit from.
Yeah.
Okay.
We all can use that leadership right now.
Right, Tomas Manglotnia, he's washing his hands as we speak. And he's our man in the CNMI. Thank you, Tomas.
Thank you, guys. Have a good Easter.
You
Happy
too.
Easter.
Oh, there you go. 9:51.
Yeah.
Yeah, it's Good Friday. I don't know. We can go to Adriana and find out what she's working on, or we could call it a show. It's up to you.
Is Adriana on the line?
She could be. She's listening.
Be.
Yeah, very good.
No, it's okay. It's okay. We can get her later. I think
okay.
She's gonna have a busy
She's
day
busy,
today.
right? Yeah. So closing it out, Bree, do you want to run through the mass schedules again?
Yeah, so Good Friday's Mass today, 2:30 in the afternoon. It'll be streaming live off of our Facebook page. We also will be broadcasting it on KUAM TV 8 as well as on KUAM TV 11. As for Easter Sunday Mass, we will be broadcasting that also again on TV 8 and TV 11 at 9:30 in the morning. And also streaming on our Facebook page. There's just so many ways to watch everything that we're doing. Yes?
Okay, and Governor Lulian Guerrero has just come out with a address this morning, and we're going to go ahead and play you guys this before we close out the show.
Half a day. Thank you again for this opportunity. And of course, today is Good Friday, and as we reflect on Good Friday, please have your prayers for a safe and healthy community and the strength to win this battle. I want to also update you that 3 tests were positive yesterday, which brings us to a total of 128 confirmed COVID cases. We do remain at 33 recoveries. And we may have more today. We will report that at our press conference. As you know, we have started also reporting clusters of contact tracing. And if you look at that data, it really shows that most of our confirmed cases or contacts or infected cases came from social gatherings, came from family gatherings, came from other big places that we come together and gather. So it just proves the point that if we limit those social gatherings, if we just don't do any social gatherings, we can start seeing less positive cases. And the proof would be in a couple of weeks, because on my directive of no social gatherings, I think I did that last week, and so we can see in another week or so whether that is having an impact in the number of positive cases that we will be seeing. But be that as it may, also in the global world and also in cases that we see in the states, especially those states that are starting to flatten their curve, they are saying that social distancing, staying home, decreasing the amount of contact, no social gatherings are the measures that have helped them into flattening the curve. So I think we are in that same direction. We have instituted these measures very proactively. And if you remember from the very beginning, we also closed various public places, senior centers, the schools, and other areas that people gather. Also, wanted to say that your support, again, is very much appreciated. And I know that it is difficult, especially in these times now where Easter Sunday is coming up. And we, of course, want to be with our children and our grandchildren. And just please keep in mind that by not doing that and by staying home is really also helping our children, our grandchildren, and our manamko. Thank you, and si Diyos masi.
Oh, there you go. Governor Lulian Guerrero wanted to give her the floor to close the show there with her Good Friday message to the people of Guam. And we had Lieutenant Governor Josh Tenorio on the show earlier. Remember, containing COVID, what we do is we take all the interviews from the show. Jason chops them all up with with his
puts it on our YouTube
right.
page. There's somebody was asking for Lieutenant Governor's office phone number.
Yeah.
His number is 475-9380. 475-9380.
And there's again been a clamoring for people to hear from Lieutenant Governor Josh Tenorio. So when we break up this interview, go listen to it. He provided a lot of information and a lot of clarification on some things. So really, really just thankful for that opportunity to have him on.
Thank you. And he's probably going to get him on next week, right?
Yeah, we're going to figure out a schedule here, but definitely the line of communication is all the way open. Yeah. It's 9:56. Sabrina, I just want to wish you a good Friday.
You too.
A happy Easter.
Joe Sir, Sark Digital, there you go.
Yep, Joe Sir. Of course, Ken Sanity, Jason Salas. From all of us here at Team KUAM, those of us who are here in the office and those of us who are working from home, thank you guys so much for all the tremendous support. And, we pledge and we're committed to continuing to bring you the latest information, accurate information, timely news.
And don't forget, starting on a Monday, we will be broadcasting on your television screens from 8 to 10 on KUAM TV 11.
And remember, Monday we are going to wear our Easter clothes.
Crisply pretty in pink.
I'm gonna be very, very purdy in pink. And is there anything else going on tonight? Obviously, we've got the Good Friday stuff, but we're doing the Stay Home Live Local Fridays. This is going to be an awesome show.
Yeah, I'm really excited about it because we reached out to musicians all over the world, really. We've got Matt LaGuardia. He's performing from Afghanistan. We have performers from Atlanta, Georgia, in California, and then, of course, our musicians that are here on Guam. So it's going to be a really good show. And 6:30 p.m. KUAM TV8.
Okay. Hey, for Sabrina Sauce, Matt Tanani wishing you and yours a good Friday and a happy and blessed Easter. We have the commitment from the Lieutenant Governor that we're going to redo Easter after all of this, and I'm going to try and get it on a weekday. I'm going to push for like a Friday, maybe 3-day weekend kind of thing.
Yeah.
We'll see. Hey, we're going to leave you with this. I put it out on the WhatsApp. This is from the year 2005.
Whoa.
Yeah, someone was like, hey, when'd you do that one? And I had to go and check. It was 2005.
And I've been wanting to hear this, so special request. Thanks, Chris.
Yeah, so this is, of course, Julius Santos, Andy Wheeler, and I, Mallet Dudes. It's a little bit of malfunction to close the show on this Good Friday. It's called Cello. It's Holy Week. Sabrina, thank you. And Guahusi Chris.
Bye. You boys better be quiet, huh? Don't make me catch you making noise, or you're gonna get it on Easter Sunday, huh? I warn you already, be quiet.
Hey, all you Catholics, it's Holy Week. Lower down your own mouth when you speak. Spring break on Holy Week, it just ain't fair. One time I yelled and my auntie pulled my hair. Down in the South, we do it the old school way. Get spanked for your sins on Easter Sunday. They fall at you, you can't hunt for eggs. Go back to school with bruises on your legs. Better be good on Good Friday, or the Babwin charisma might take you away. Better don't stain your Easter dress, 'cause Tanchai spanks like barley dress. Cello, it's Holy Week. Cello, it's Holy Week. Cello, it's Holy Week. Cello, it's Holy Week.
Keep the candles lit, don't let them go out. Whatever you do, make sure you don't shout. Adai ipatsomo pop para. Sakomola agama mada. Praying rosary till my knees is galdos. But it don't hurt 'cause we do it for Toros. If you gave it up for Lent, don't give in. God's not sleeping and you know it's a sin. Cello, it's Holy Week. Cello, it's Holy Week. Cello, it's Holy Week. Cello, it's Holy Week. Cello don't eat red meat. Man. 'Cause Cello, it's Holy Week. Oh. Cello don't eat red meat. Man. 'Cause Cello, it's Holy Week. Oh. Eating Guian every day. Fried fish, calaguin, and fish fillet. God, I'll sack and balaxi. A tool like my agama futi. We even got the milkfish and tilapia. Marlin, mahi, bonita. Man, I can't wait to chow steak from the grill. I chowed so much fish, I got gills for reals. Cello, it's Holy Week.
Wait, what?
Cello, it's Holy Week.
What's that?
Cello, it's Holy Week.
I didn't hear what?
Cello, it's Holy Week.
Dude, why are you whispering? I can't hear you. What are you
Stop yelling, it's Holy Week.
I'm not yelling.
Ah.
Ow! What the? Ow! What?
You stop yelling.
Ow!
I told you don't yell.
Tenchai, you're the one that's yelling.
Yeah, Tenchai, you're the one that's yelling.
Just wait and you're gonna get it on Easter. Toka.
Half a day, Guam. Stay home and keep safe. And if you need to be out, Wendy's is ready to serve